Before we start, we would like to acknowledge our APPD faculty advisor, Dr. Michael Dell, Vice Chair of Education at Case Western Reserve University School of Medicine, as well as Colleen Hughes, who serves as the Associate Executive Director for the APPD. We would also like to acknowledge our ComSep faculty advisor, Dr. Rachel Thompson, Assistant Professor of Pediatrics and Director of Pediatric Undergraduate Medical Education at the Boston University Trobanian and Abbott School of Medicine. Those individuals have made tonight possible, and we are grateful for their support. It is now our pleasure to introduce you all to our Assistant Director of Webinars for the South Atlantic region, Alicia Griffiths. Her pronouns are she, her, and as of today, she's a graduate of Trinity School of Medicine, located in St. Vincent in the Grenadines. She was born and raised in Queens, New York, but currently resides in Georgia. She is the first in her family to pursue medicine.
Thank you for that lovely introduction, Estelle. We would also like to introduce our FPR Webinar Associate Director working hard behind the scenes tonight, and that's Denise. And now let's delve into our goals for the night. Once again, we want to welcome everyone for joining us tonight. We're so excited to have everyone at the South Atlantic Part 1 Regional Webinar and are grateful to all the program directors and assistants, as well as coordinators and residents who have taken time out to be with us tonight. Our series goals for the regional webinars are providing pediatric residency applicants with foundational knowledge surrounding the virtual interview season, well-rounded insight into the benefits of programs by region, and devoted time for live question and answers. We will be transitioning to our breakout rooms shortly. In each room, applicants will be able to learn about some of the programs and ask questions near the end. All the breakout rooms are recorded, so if you are interested in learning about the other programs that are not in your own breakout room, you can check it out our YouTube page later for the recordings. After that, we will move to our resident happy hour. During the resident happy hour, there will be residents and applicants in the breakout rooms to connect, discuss, and get firsthand information about the various programs. Please feel free to grab a beverage or snack for some fun conversations. And please note that the resident happy hour portion is not going to be recorded this evening. So before we move on, we will have the APPD representatives of the South Atlantic states, Dr. Inga Eggman, Dr. Corinne Bria, and Dr. Gia Bradley, to give us a quick overview of some of the states included in the South Atlantic area from the APPD leadership in that region. And Dr. Eggman, are you here? And would you mind starting us off?
Sure. Hi, good night, everyone. I'm Inga Eggman. I'm one of the associate program directors at ECU Health in Greenville, North Carolina, and I also serve as of July, the immediate past chair of the APPD Southeast region. Dr. Bria is sorry that she couldn't be here this evening, but just wanted to tell you a little bit about the Southeast and all the great things that you can expect if you do practice in this area. And we could go on to the next slide, please. So we'll talk briefly about the leadership team, who we are, and then training in the Southeast. So like I said, I'm at East Carolina University in Greenville, North Carolina, and I'm currently the immediate past chair. And then Dr. Bria, whose photo you saw earlier, she is the current chair of the region. We could, move on. So we serve quite a big catchment area. The Southeast region is the largest region in APPD, and you can see all of the states represented in our region, in addition to Puerto Rico, which we're really excited about. And we can move on to the next slide. So I think the big highlights of our region and what makes it special training here, we're very fortunate that we work in a big geographical area. So we have a very diverse patient population, not only in terms of ethnicity, but also socioeconomic background as well. From a training standpoint, as someone who has trained in the Northeast and Midwest, cost of living here is pretty reasonable. And as a resident, it's very feasible for you to own property over the course of your training, or landscapes. You can see from our geographical area, you have the mountains to the west, the sea to the east, and so a lot of great terrain to visit and explore on your off days, and of course amazing food. To throw in a picture of chicken and waffles there, kind of a staple for what you would see in the South. We can move on to the next slide. So like I had mentioned before, in terms of training, you really have a wide variety of programs, both in urban and rural locations, and great exposure to general and subspecialty pediatrics, and exposure to other core tenets of pediatrics like quality improvement and advocacy. I think that one of the things that stands out about our region is that, unfortunately, we do serve a large underserved population, and so you get well-versed in advocating for patients, both within your communities, but also in the wider region. And we do serve very large catchment areas and have a diverse patient population, like I had mentioned before. There are also a lot of opportunities for global health and rural outreach medicine in our region. So if that's something that you are interested in, definitely things that you can experience over the course of residency. And then, like I had mentioned earlier, we're very fortunate that we have residents not only from all across the country, but all around the world coming to train with us, and they really have a passion for caring for children and their community. And I think regardless of what your ultimate career path will end up being after residency, you definitely will have great exposure and training in this region, kind of coupled with just friendly people that you'll meet along the way. So I think that is all I have. Best of luck to you on your match and your interview season. I'm looking forward to talking with you all in one of the breakout rooms later. Thanks.
Thank you, Dr. Aikman. Dr. Bradley, do you want to add anything else before we move on to the breakout rooms?
Yeah, absolutely. So I am one of the regional co-chairs for the Mid-Atlantic region. And as you can see there, we are a very small but very mighty region. We are so mighty that we are spread out among 3 of these FuturePedsRes webinars. So you'll get to hear a lot about the Mid-Atlantic region if you attend all of these events. I am Associate Program Director at Sinai Hospital in Baltimore. My other regional co-chairs are Dr. Aaron Shedlock. He is Program Director at Penn State Hershey, and Jennifer Pommichter. She is a Program Coordinator at Children's National Hospital in DC. Some highlights and advantages of the Mid-Atlantic region. As you can see, we are more centrally located there on the East Coast. And given that we are in close proximity to one another, it's easy to get around our region via driving, train, and we have plenty of airports if you ever felt like you needed to get in or out via a different route. We have lots of major cities, as you know, within that area. We have beaches, mountains, lots of terrain. Given that we are all, again, in close proximity, it does make it an ideal region for collaborating in advocacy, networking for employment regionally, and participating in the active chapters of things like the American Academy of Pediatrics. It's also a popular region for conferences, so many of you will visit us for that reason as well. Similar to what you heard about the Southeast, we have a variety of program sizes, and you'll hear more about that this evening and on other nights. For example, my program has 8 residents per year, but others have over 50 residents per year. We have pediatric hospitals within hospital systems and freestanding children's hospitals. Some of our programs have pediatric fellowships, while some do not. We have the military program within our region at the National Capital Consortium. We have urban and rural programs, a lot of patient diversity with unique populations, and again, a strong focus on advocacy, regional healthcare disparities, and regional risks. So we're excited for you to get to know our region and all of the others, and wish you all of the best with this whole process.
Thank you so much, Dr. Bradley. All righty, so now I would like to introduce our participating programs for tonight. If we can get that slide up. While we get that together, I just want to let you guys know we'll now be going into our breakout rooms. So throughout the webinar, you can ask questions using the chat box on Zoom. You can also amplify insights or what you have learned from the webinar on Twitter using hashtag FPR webinar and hashtag PedsMatch2024. So here are the breakout rooms, and we will give everyone a few minutes to join the respective rooms. Afterwards, our amazing program director panel will log off, and our resident panel will join us from 9 to 9:30 p.m. to share their experiences and answer any questions from the audience. Thank you. All right, let's get started. We will begin with MedStar Georgetown.
Hello there. Good morning. Good evening. My name is
You can see
Kristen.
your screen, but it's not on the individual infographic.
Hi, good evening, everyone. My name is Kristen Hopkins. I'm the program director here at MedStar Georgetown, and I believe I have in the room two of our two chief residents, Harry Mastaklis and Sarah Magaziner here as well. And we are a medium, smallish program based in Washington, D.C. And we are a little bit unique in our situation in the District of Columbia. We have 11 categorical residents and 4 medicine pediatric residents per year, which adds a lot to our experience having our med-peds residents as well. And we're primarily focused on the resident education. We have only fellows in our neonatal ICU, and every other year or so we have a community pediatric fellow. So otherwise it's really a resident run program. We have experience though in 5 different settings in the District of Columbia and the greater DC area. Because DC is pretty small geographically, it's easy to get to our other sites, both in Virginia and in Maryland. And so you do get the opportunity to practice in a variety of settings, both community hospitals, university-based hospitals, and freestanding children's hospitals, at least one of which you'll hear about this evening from Children's National. We have a pretty small resident to patient ratio, and really getting the opportunity to get to know your patients well as experiencing a variety of patients between the 5 locations. Our continuity clinics are all based in one site, where we have the unique opportunity to have an integrated behavioral health program that's really robust, including a psychiatrist who is there not to see patients on their own, but to actually teach our residents how to manage behavioral health in the primary care setting. But along with that, we have a robust behavioral health curriculum that expands into our academic half day as well, which really focuses not just on primary care, but subspecialty care. It's a really unique aspect of our program. Excuse me. We have a strong emphasis on resident wellness and support. We are part of a larger MedStar health organization, which is 10 hospitals actually in the greater DC Baltimore area. But within that, we're the only main pediatric hospital. There are some smaller NICUs in some of the other hospitals, but we're the only general pediatrics. And so we get a lot of unique opportunities as part of that. being in the District of Columbia, we have opportunities to do some pretty cool things for our annual retreats. This year, our chiefs who are on the call here planned our spring retreat, where we got to have a lot of fun enjoying some of our DC monuments and getting to get outside and enjoy the spring weather before we got a little too hot and sweaty the last couple of days. We do accept J1 visas. I know that's a concern for many of our applicants, and our program is really diverse, both where our residents come from internationally and within the US, and that really reflects our patient population. We have patients from all over the DC area, but also internationally. We have a unique solid organ transplant program that brings patients from all over the world for both liver and small bowel transplants, and then a really unique and growing young adult and adolescent hematology oncology program. So some neat experiences that you have access to within our own hospital. And we are available for any questions. We'll be able to be here for the chat afterwards, and want to pass it along, I guess, to the next person here.
Thank you so much.
Sure.
All right. Can you all see the advancements of the screen?
Not
Okay.
yet.
No,
Now you got it.
All righty.
is there a larger presentation mode you can put it on? Or
So can you see it?
we can see it. I don't know if it can be bigger.
We can see it, but we can see lots of other stuff too. So if you,
Right.
that little button on the bottom that has the two arrows going diagonally in the bottom right next to the question mark, I bet if you click that, you'll be good. Or not.
I think you need to share your whole screen.
Okay, let's.
You're just sharing the specific document.
Yeah.
You need to
Yeah.
share your whole screen. Yes.
Do that now. I am so sorry, you all.
It's all good. The world is a baffling place these days.
How is that now?
Oh, boom.
Perfect. All right. Children's National Hospital, can you please tell us about your program?
Yeah, absolutely happy to. My name's I'm the Assistant Program Director for Entrance Selection. I'm here with Erica and Jana, who are two of our chief residents who joined us this evening as well. You've already heard a lot from Dr. Hopkins about the DC area, and like the Georgetown program, I'm really happy to be here. It allows us to focus on a lot of the things that we care a lot about. We have tracks in our program looking at primary care, looking at under-resourced communities. We also have tracks in research in child neurology, as well as a combined program with the genetics program. And what I really like is that because of our proximity to Capitol Hill and the seat of the government, we have a lot of advocacy opportunities for all of our residents, not just the ones who are in our launch track, but really pathways for every resident who's interested in education and advocacy to get involved. I'll let you read here about the different offerings that we have. A few things that we're really proud of is our chiefs are very responsive to the needs of our residents, and we've made a lot of changes to our curriculum, to our scheduling, which we're happy to speak to over the past 2 years, really to make that resident experience better. You heard Dr. Hopkins talk about our desire to improve resident wellness, and I think one of the best ways for us to do that is being responsive to needs when it comes to scheduling. Like you just heard about Georgetown, we also accept J1, H1B, and F1 visas. And one thing that we're particularly proud of is our work in the DEI field. Our program director, Aisha Barber, has really been a champion of that for many years. And we're proud to say that 36% of our residents at CNH identify as residents from UIM backgrounds. That's something that we've worked really hard to achieve, and to not just to get those residents in the door, but to really mentor them and help them throughout once they get here. So that's certainly a focus of ours. When it comes to clinical experience, we take care of a large volume of patients, mainly at the main campus, but residents also rotate at GW, where they work at the NICU, and at various community sites around the city. So certainly happy to talk to you guys about the clinical experience here when we get the chance as well. And I'll leave it at that.
Thank you so much. All right. So now we will have Sinai Hospital of Baltimore. Would your representative please unmute?
Hi, I'm Dr. Jenny Hart. I'm the program director at Sinai Hospital. I am joined by Dr. Bradley, who you already heard from, who's also from our hospital, in addition to being the regional chair. And then our chief resident, Mizna, is joining as well. So I think I'm saying a few minutes of words and then she's going to chime in from her perspective. But our program is probably the smallest one in this breakout room. So we take 8 residents per year and we're considered a community-based hospital program. We are located in Baltimore City in close proximity to the other Baltimore programs, Johns Hopkins and University of Maryland. And I think what really makes our program unique is the size of our program. So we have a diverse resident population with residents from USMD schools, osteopathic schools, Caribbean schools, international medical grads. We also take J1 visas. And we have a very close-knit environment between our faculty and our residents, and that really fosters a great relationship for mentoring, so that you really get individualized attention. You form these very strong longitudinal connections with your attendings. We have a very heavily involved scholarly activity committee where residents really learn the basics of designing a good study question, going through IRB approval and getting that close mentorship. And then I think that the diversity of our area, which you've already heard about, opportunities for advocacy, which you've already heard about, just strengthen our program even more. We're very fortunate to partner with Johns Hopkins and the Kennedy Krieger Institute for multiple rotations so that you get the experience of a community hospital, but also the experience of a large tertiary care center with multiple subspecialty services. So we think that that really augments the experience that you get in the education here. We're really excited for several of our curricular initiatives, one being a boot camp curriculum where residents spend one block at the beginning of their intern year, rotating through some of the core pediatric residency sites to focus on things like putting in orders and getting familiar with your organization system and so forth. And that's a curriculum that has gotten really high praise from our interns who've gone through it so far. Like probably most of the programs on this call, we're gearing up for some changes that the ACGME is making. So although we have a traditional block schedule right now, we're probably moving toward an X+Y schedule in the next year or so. We're also fortunate that the former program director of
Please unmute.
Yes. Hi, my name is Vandana Racherla. I'm the assistant program. Are located our media circle. Just wanted to highlight is really the individualized education that depending on really what you're interested in, you're able to sort of tailor your experience in residency to that. We have a strong emphasis on resident wellness, creating a balanced schedule. We have regular kind of feedback sessions with our residents, and they sort of led the charge in helping us sort of change from a Q4 24-hour call in our ICUs to shift-based work. So we really do listen to the residents and their feedback. We also have a mental health opt-out program for all residents. So we sort of set you up with an appointment and really encourage you to programs. So we have a pediatric diversity council that is department-wide, so it has faculty and resident involvement. We have 3 subcommittees for education, recruitment and mentoring, and community engagement, and there's always things going on. We do have a social justice curriculum, so we have monthly morning report, monthly noon conference, and then quarterly department-wide grand rounds. We will also be having social hours throughout the recruitment season, so definitely check those out when you can. And then I guess the other thing I do want to highlight is just that Baltimore is sometimes doesn't get the best reputation, but it has been a fabulous place to live. I still live here with my family and my daughter, and we enjoy sort of all the things that Baltimore has to offer in terms of kind of dining, unique neighborhoods, lots of fun things in the area. So hopefully you come and check us out. Thanks.
Thank you. All right. We will now have Johns Hopkins, if a program representative will come on, unmute.
Awesome. Hello, everyone. My name is Marquita Genus, and I'm the Associate Residency Program Director for Hopkins. I have the wonderful opportunity to tell you why Hopkins is for you and why you should choose to apply to us. I am stepping in for our Program Director, Dr. Sholkowski, who is working in the PICU tonight. So as you can see from my background, I have a picture of the Children's Center, which was newly opened in 2012. We have 205 inpatient beds and about 45 NICU and PICU beds. One thing that I appreciate about Hopkins is that we are a large tertiary care academic referral center. So not only do you get our bread and butter pediatrics from our community, but also we get a lot of referrals from national as well as international. We have Q for ACGME. There's actual longitudinal curriculum integrated into your community hospital rotation where you really learn about methodology for QI. While it's not a requirement, a lot of our residents do go ahead and present abstracts at regional and national meetings, which shows that the research is to the caliber for peer review and acceptance and dissemination. Like a lot of residency programs here today, we work hard, but we play hard too, and really like to provide an opportunity for our residents to get to know each other, get to know faculty, as well as program leadership. We provide them with coverage to participate in sort of activities. One fall retreat coming up, I'm really excited about that. We also have Peds Prom as well as Crab Feast, which is in the summer to welcome our interns and gives our upper levels an opportunity to make fun of program leadership and do a movie and really highlight their experiences and really break the ice for our interns. In terms of our curriculum, we have traditional block schedule. One thing that I appreciate, as you can see, I appreciate a lot of things about our program, is that not only do we do exceptional training for you to become a pediatrician, but if you come in with interest in global health and health equity, we have specific tracks where you can rank into. We accept 2 residents per year. And again, really gives you additional competency in global health and equity and health disparities research. For those who have an interest in research, we have accelerated as well as integrated research pathway. One is more geared toward ND PhD candidates, and you guys can learn a little bit more about that on our website. In addition to getting exceptional sort of clinical training, we also recognize the importance of professional development outside of the delivery of healthcare. So we believe that we as physicians are medical educators, and we like to train our physicians as such. And I think that sets us apart from a lot of residency programs in the region. So we have a resident as teachers curriculum throughout all 3 years of your training. It's sort of gradated sort of training in terms of being a master educator in medical education. We also have a track for those who are interested in medical education in their future, but you guys will learn if you interview with us. In addition, we also have a commitment to diversity, equity, and inclusion. It was highlighted that Baltimore in our region serves a very diverse patient population. We have a Peds diversity, equity, and Inclusion Council, which is comprised of fellows, faculty, and residents, really focused on the recruitment, retention, and advancement of underrepresented medicine trainees, recognizing that goes beyond race and ethnicity, but also recognizing our LGBTQ community, as well as those with disabilities and other areas that make inclusivity. All of the work that we do in sort of the Department of Pediatrics, and well as Johns Hopkins as a whole, has been recognized nationally in receipt of the Barbara Ross Lee DEI Medical Education Award. We also have a visiting elective program. I know we have fourth years, but if you have third years who are interested, please let them know to apply. It's a paid program. We have opportunity to come into the program to learn. We also do a lot of community service work, which you guys can learn about our program. And then, as my colleague said before, we're in Baltimore. Baltimore gets a bad rap sometimes, but it's an excellent place to not only train, but also live. You guys will see if you interview with us, a lot of our faculty members have trained here and have stayed here for 10 or more years because it's an excellent place not only to provide care to our patients, but to really raise your family. And I look forward to fielding any questions later.
Thank you so much. All right, we have our final program for this breakout room, Sidney Kimmel Medical College, Nemours Children's Health.
Yeah, hey everybody. I'm Brian Alverson. I'm the residency director at Sidney Kimmel. We also usually call it Nemours Children's Hospital. It used to be called DuPont Children's Hospital, so a lot of confusion there. We're basically located mostly in Wilmington, Delaware, but Wilmington's quite close to Philadelphia. It's about a half-hour drive. So you could also do your primary care clinic in downtown Philadelphia, as well as in Wilmington, Delaware. Most of the inpatient stuff is at our children's hospital, which is a freestanding, fully functional children's hospital with all service lines. It's a great hospital. It's located in a state park in Delaware. It's totally gorgeous. And we we're a sort of a cool program because it's mid-sized, but we have all service lines and we're a large children's hospital. So everyone gets to be friends. We have a really tight family feel. That's what we focus on. And also you get to see every exotic disease you could imagine coming in the door. We have a very high level of complexity, so you'll learn a ton. We're X+Y. We do have tracks in health equity, leadership, and advocacy. It's our HeLA track. We're starting it this year, and it's really exciting. The residents in the HeLA track do their primary care in a very special clinic called the Jessup Street Clinic, which serves a very poor and diverse population. It's a really great opportunity. Then we also have our global health track, where you can do rotations on the Navajo reservation. You can do rotations in Jamaica, Africa, a variety of other places. But also, it's more than just doing rotations there. You're learning how to be an effective leader and advocate for change in countries with fewer opportunities and resources. And it's a really, really amazing experience. And we've really worked on that curriculum thoroughly. We have an advocacy curriculum as well. And we have all the other things that we do with other integrated programs like MedPeds, Peds Neuro. Additionally, we're basically a sort of very friendly bunch. We have a bunch of great activities that we do together. Really fun retreats out on the beach in Delaware, and a really wonderful, warm group of faculty. The faculty you get to know really well. You come to our houses for dinner. We're all friends. And what I sort of love about the place is there's a lot of really close mentorship. So we also have an education program, residents as educators, and it's a 3-year process, and you get oversight with a bunch of different attendings. There's 2 of my associate program directors are here, and we're just going to talk a little bit about. I want Jill to talk a little bit about living in Delaware, and then Robin's going to talk about our amazing diversity opportunities and efforts. So I'm going to hand it over to Jill.
Hi, everyone. My name is Jill Savage. I'm one of the APDs at Nemours Children's Health Delaware. Really excited to meet all of you today, and specifically highlight our fabulous location of Wilmington, Delaware. I'm definitely biased. I was born and raised in this town and love it. But similar to all of y'all, in Baltimore, sometimes Delaware, people wonder what the heck happens there and what do you do? And so just briefly, Delaware is a really fun place to live. As Brian mentioned, our hospital is housed in one of the mansions, the Nemours mansion and gardens. Additionally, there's tons of beautiful landscape, which is all the original DuPont family, which was kind of one of the powerhouse families that started the wealth in Delaware many years ago. And so all of their homes and estates and gardens have been turned into state parks. So it's pretty awesome to have that right at our fingertips. I'm an emergency medicine physician, so being near an inner city was a great place to train in terms of being exposed to trauma. And so we have seen a lot of trauma, so it's great from a training perspective. But I'm additionally raising my family here. I have 3 kids. It's a great place for the school system, great place to buy a home, and great place to train. So we would love to have you. We look forward to talking to you definitely along the interview trail. Wishing you the best of luck. I'll turn it over to Robin.
Hi, everyone. I'm Robin Miller. I'm an associate program director as well at Nemours here in Delaware. We have some exciting diversity initiatives. We have to it based on feedback and just the changing scope of medicine. Our academic institution is Jefferson in Philadelphia, and so you are able to participate in their Alliance for Minority Health Professionals as a way to have exposure to other specialties doing diversity initiatives. Here at Nemours, which is a separate institution for our hospital, they have associate resource groups as well that are dedicated to diversity and have certain initiatives at the hospital. As part of our residency program, our noon conference has done an overhaul, and so we have a diversity initiative to all of our new conferences. We are unique because we're at Nemours in Delaware, but we also have a working relationship with the Nemours in Florida. And so as one of the initiatives, we're pooling resources to sort of revamp and sort of beef up our diversity new conferences for all of our lectures. We have a diversity interest group where everyone is definitely welcome to join. We have fun things planned. We did a movie night last year. We plan to continue that this year because it was a hit, but we're also doing a diversity dinner club and a couple of other fun activities that are coming throughout the year. It's a focus on recruitment as well as education throughout the school year, throughout the academic year. And so we are dedicated to diversity here at Nemours and look forward to more initiatives and bringing more people on board. It's nice to meet everyone tonight.
Thank you so much. All righty. So that concludes the pediatric program overview portion of the evening. So now we will open up the floor to a live question and answer session. So if you have any questions, you can either put them in the chat or unmute your mic and ask whoever you would like to ask. Floor is now open.
Hi, thank you all for speaking today. I really appreciate the opportunity to hear from you guys. I would love to hear from all the programs about what your program is doing to improve resident wellness.
I guess I can start. We have a pretty substantial budget for resident wellness. From the basic thing, we basically give you all your food for free. I think that helps. You come to noon conference and we're going to feed you, which is lovely. We also have opt-out mental health counseling so that you will get a call from a therapist. You can always opt out, but we make sure that destigmatizes the need for talking to a therapist, which I personally think is important for everybody to be able to talk about issues that are going on in their lives. If we don't tackle mental illness in the medical field, who are we as physicians? We have a huge number of activities. We have a softball team. I just made all the t-shirts yesterday. That was really fun. We have a whole bunch of activities that we have. One of the associate program directors, Casey Coleman, is our wellness guru, and we do, oh my gosh, every Friday there's activities. We have yoga, we have planting succulents. I can't begin to list the number of activities, but it's important also that, when things go bad, you have help. And we firmly believe that a family environment is how you survive, and loving each other. And we lead and survive with a family feel. So when, a child dies, we all get together, we talk about it. And I think that learning how to work through those moments of sadness is how we all can go forward, and we do it together.
Hi, it's Marquita from Hopkins. I think we all similarly probably all do the same thing in terms of wellness. I think we will all say we have a family field program. We also have opt-in or opt-out appointments for mental health for all of our incoming interns when they come in, and all interns when they come to our program have the option to opt out of mental health. In addition, we have a wellness committee that is ran by one resident representative or two resident representatives from each class, and they are giving funding so that they can choose things that they want to do as a sort of cohort for their wellness. And in terms of the residency program, we have other funding to support some of the events that I told you guys, such as our fall picnic, our Peds prom, et cetera. We also integrate wellness-based lectures into our noon conference, making sure that people know that wellness and mental health should be destigmatized and something that we're open and honest and talking about in our everyday talk. So there's opportunities through our noon conference to learn about burnout, sleep, fatigue. We also have backup system where if residents need to leave due to feeling fatigued or having signs or symptoms of burnout, we have that system so that we can utilize it when necessary, and then appropriately connecting students with My Support, which is a system within Hopkins to get sort of emergently connected with a mental health specialist if needed. So a lot of primary, secondary, and tertiary support systems. But I think one thing about our program is like, we do have a family feel as a program, and all program directors and chief residents have an open door policy, and residents know that they can come to us at any time when they need support for anything wellness related. So yeah.
Hi, this is Jana from Children's National. I'm one of the chief residents, and I'm the wellness chief as well. So basically, we do prioritize wellness a lot, and we also have all the opt-out sessions for all the residents. For interns specifically, we do have a float weekly, a 3-day weekend when you're on an inpatient unit, and also at the end of the first year, we do a beach week where all the interns can go and also like have a good time together, in addition to like bonding as well. In addition to that, we have a psychologist who's dedicated to each program as well. Like she will meet with everyone, and also like if needed, she's available by appointments as well. We do everything else like meditation, yoga. We have like specific places like Healing Garden that's like patients go, and also we have like Mickey Garden where staff can go and just like have a dinner, like a lunch outside and stuff. In addition to that, we do have December party, Wellness Wednesdays, yoga and art. So like we do a bunch of things as well. This is like an improving focus on our residency program as well. And also we are trying to reduce 24-hour shifts as much as possible. Even though we are a big program, we try to get all the coverage as much as possible. And so we split shifts as well.
Yeah, this is Vandana from University of Maryland. Services, we have, we call them stagely. You can take them whenever you want, sort of no questions asked. That's time for you to do whatever it is that you need to do, and not for doctor's appointments because those can be scheduled around other things. So really you can take those wellness days when you want. We do have like a backup system. So we know if we have residents who are worried about, who are particularly burnt out or come to the chiefs and the chiefs are worried, we often can use our sick call system for that too, which has been great. So not just for, illness of, colds and things like that, but also for our residents who are feeling particularly burnt out or need some extra time. And then we do have a resiliency retreat workshop that is like a full day for our PGY2 residents, sort of halfway through the year when they're probably their most burnt out. And we really focus on sort of talking about what ways they can sort of build resiliency, and sort of talking about tools that they can use, and also talking through the hard parts of medicine, like was spoken about before, and sort of how do you get through those things. So
we sort of do it all throughout residency, but we have a day dedicated for our residents to be able to do that as well. So yeah, in addition to all, retreats and things like that we do throughout each year.
Hi, I'm Mez from Sinai. I'm going to be quick with mine because we're repeating a lot. We have a wellness committee, resident run, same mental health supports. I was talking about our Nintendo Switch that we have on the unit. We have tournaments all the time. We have an elliptical on the unit, a massage chair, group yoga. Something I enjoy is liver rounds. It's a monthly meeting that we go out with the attendings. Last time we went to did trivia as a group. The competition was fierce. We celebrate holidays, Eid, Christmas, Rosh Hashanah, Diwali. I organized a retreat a couple months ago to Hershey Park. A bunch of us got together, rode all the roller coasters. So lots of wellness at our program too.
All right. Any other questions?
I actually have a question, if that's okay. My name is Andrew Joseph, fourth year medical student from Nova Southeastern in Florida. My question was actually to all of the speakers. First, just thank you so much for taking the time to share all of your incredible programs. The biggest question that I had was, obviously, you get a lot more applicants than spots for your residency programs. And so I was just wondering, what are some things that you look for in the overall application that may help an individual stand out if there are certain deficiencies in said application, perhaps in regards to COMLEX or USMLE scores? Thank you.
I think in general, Andrew, all of us are probably looking for the applicants who focus. So I wouldn't necessarily percent rate on one area of your application, but just just highlight what you're good at, what your own strengths are, and why you want to do this.
I think Gia summed that up really nicely. I think, but also you mentioned as well, taking ownership or just being very open and honest about any concerns that you have in your own application and figuring out a way to address them, whether it's in your personal statement or through your letter writers as well, because most of us are really doing a holistic review where we're looking at the whole picture and trying to build a class where we have a little bit of everything and looking for a team that's going to work together well.
And certainly clinical I think was a things you've been interested in, well, that's interested in med. To me,
somebody in the chat asked a question about what X+Y means. So if any of the programs on X+Y want to give a 1 or 2 sentence summary of that.
I can speak on X+Y. This is Robin Miller from Nemours again. So X+Y is a different cadence to your educational blocks. And so traditionally, we were at a traditional block program where we had 4 weeks for each block, which ended up to be 13 blocks throughout the year. And so X+Y is a different cadence. Of your Y block. And so the Y block is where it's a little bit more fluid. Your continuity clinics are moved to the Y block. And so they're concentrated like 4 clinics in those 2 weeks, as opposed to being spread out across your 4 weeks of blocks. And so you don't get pulled away from inpatient. You dedicate all your time and thought to inpatient while you're there. And then you do outpatient during your Y blocks. And so that allows you to have about the same number, maybe a little bit less of continuity clinics, but the learning and the immersion into outpatient is oftentimes a little bit more helpful for education. And then it also helps with a little bit more flexibility and scheduling. So we'll have admin days that are in your Y block. And so you have like an afternoon every 6 weeks or so that allows you to sort of plan for life, to make those doctor's appointments and live life. You do have electives that happen during that time, and it helps you sort of individualize your plan as you go through. And so it is just a way to have a little bit more flexibility. And then when you're inpatient, be really immersed. And when you're out of inpatient, you can really dedicate your thought process to the other things that you're doing.
It looks like a few people had their hands up. Jose, did you have a question?
Yes, thank you for introducing your programs. My question is, how do you guys approach like to applicants that are doing the couples match, or how should we approach to you guys if we are thinking on doing the couples match?
I think it's mostly just making sure we know, like know that your couple's matching and know where your interests lie.
It's pretty common. We have on any given year, 10 to 18% of our applicants are couples matching. So I think it's pretty common in the DMV area. We have couples in our program, including one who's on the chat here, our chief resident, whose significant others in Baltimore. So it's pretty easy to do to DC, Baltimore, and in the area. And we've had that multiple times in the past, as well as military match. That's the one part for military match that we don't see on our end from ERAS. So if you have a couple who's a partner who's military match with Fort Belvoir or Walter Reed, Bethesda Navy, please reach out or let us know in some capacity, because otherwise we won't know that.
Yeah, I would also say, like, in addition, sort of let us know sort of couples match for those in medicine, but we're all family programs. And if you have a partner who you're considering relocating, we also help with connections with people. If we know people outside of medicine, for example, we've connected people who are interested in becoming teachers with connections that we have, just so you can know what your life would be like in Baltimore as a resident here at Hopkins. So we want to know about your family and how we can help you learn about how you and your family fit into our program as well as in Baltimore.
Thank you so much.
Bashara?
Thank you to all the program directors for taking the time to speak to us. I'm a foreign medical graduate from Pakistan, and I worked in a public setup where there was a lot of, we were a resource limited setups. So I was really interested in learning about the global health electives that a few of the programs talked about. And I would like to know what, if you could just highlight the impact that these programs created and what kind of opportunities there are. And if this track is separate from a residency program or is it integrated? Just wanting to understand more about that. Thank you so much.
So our program, we have a global health sort of track that you can rank into that we accept 2 residents per year. But in addition, sort of global health research and providing care to low resource settings is an academic interest of our residency program director, Dr. Shalkowski. So actually more residents that are outside of the track do global health opportunities. Some are in Madagascar, Morocco, the Philippines, Kenya. If you go to our website, there is a map that shows all of the countries that we visit. I think one thing that's special about Hopkins is that we're a children's center, part of a larger academic institution. So we have the International Global Health Institute that a lot of our residents can connect with faculty members who do research as well, to do other sort of global health research opportunities as well. So you can match into a track if you want to commit to getting academic training specifically to research in low resource settings, Or if you just have an interest in global health, you can also do global health research or global health experiences as part of your electives.
All right, and we can just take one more question. We do have to move on to the resident happy hour.
Yeah, so
Hi, my name's Alana. For Dr. Alverson. If you don't mind, could you talk a little bit more about the Healer track and what that entails?
So Brian
I'm
Alverson
sorry.
have to jump
Go ahead,
off,
Robin.
Jim. And so it's our health equity track that we're starting. And so it is at clinic in inner city Wilmington is where it will be based. And so with that one, the cadence will be a little different. We're looking to have, instead of the strict X plus Y and sort of the clinic sort of just in the Y block, they're sort of spread out to give a little better continuity that works better in that setting. And so patients do come back and sort of follow along. Our other clinics, that continuity wasn't the same. And so we're able to sort of personalize that tract. It's a focus on social determinants of health and sort of learning a little bit more about that throughout the tract and your educational experience. Did that answer your question?
Yes, thank you so much.
Oh, hopefully everyone's questions was answered in the chat, but we do need to move on. So now we will ask our program directors to kindly log off, and we'll transition to our resident panel portion of the evening.
Welcome everyone to room 2. My name is Divya Kevaramani and my pronouns are she, her. I recently graduated from medical school in January and I'm currently serving as a research fellow at Children's Hospital of Pittsburgh. I would also like to introduce our FPR member, Alex, who's working really hard behind the scenes recording. I would also like to introduce our program representatives I would like to invite our program representatives to give a short presentation on their programs for 5 minutes for the first part of the evening, and then we will take questions after all the presentations. Attendees, you can however leave your questions in the chat as we go. We also encourage programs to make use of the chat to answer any questions they can in case we run out of time. At 1 minute remaining, I will notify the presenter, so please excuse me for that. Our first program for the evening is Atrium Health Carolina. I would like to invite your representative to please unmute and tell us about your program.
Hey, good evening, everybody. I am Steve Hannigan. I am our APD for recruitment in Charlotte, North Carolina. And if you haven't heard of us, it's probably because our name has changed about 6 times in the past 3 years, but we have a recent affiliation with Wake. We were Carolina's Medical Center, became Carolina's Healthcare System, became Atrium Health, but we remain the county hospital, the flagship hospital of Atrium Health, Levine Children's. And anyway, it's great to be here. So I describe our program to people who aren't as familiar with us as Goldilocks. We are top 10 in a few things. So we have one of the top 10 cardiology programs in the country. We have, and Charlotte in general is my Goldilocks city. So we have one of the top 10 busiest airports. And I feel like our residency is the right size. So for a hospital of our size, we have 250 beds and we're getting bigger right now. Actually, we're building a second PICU. But we're expanding to 16 residents per class year, and we still have a really great ratio of residents to patients. The nice thing is you'll be joining a program where the residents aren't used to staffing the entire hospital. So we have a ton of nurse practitioners and PAs who handle the volume, so we respect our residents' learning caps, and they can focus on learning and learning through patient care. So Dr. Primus is our program director. She is on vacation. She's in Canada, and she sent me this beautiful picture, like having a picnic next to a mountain. It looked awesome. If she were here, she'd want me to talk about wellness. So she is the vice chair of education. She's a program director, and she's the director of wellness for all of medical education for our campus. And we have a really active wellness committee. We have monthly social events at Dr. Primus's house. Generally it's one class, but around the holidays, she has all the classes over for a big holiday party and white elephant gift exchange, which is always a highlight. And we do have faculty coverage for that party, for the graduation every year. We also do other social events outside of that. So our social committee usually plans an event about every other month. We'll go to the baseball games, which has an awesome stadium in Uptown Charlotte. Or we usually do a football tailgate for the Panthers. If they're good this year, we'll definitely do one of those. And we'll go to like new restaurants that are opening, or do like trivia at a brewery or something fun. As far as going to fellowship, about 2/3 of residents go on to fellowship. For those who choose to stay in Charlotte, we have an excellent track record of placing residents in primary care peds jobs in and around Charlotte. The city has grown 3 to 4% every year since 1990, which means that we're always growing. There are always jobs. Even in the kind of interesting job market we saw after COVID, we were able to place all of our graduates who wanted to stay here into jobs locally, which was great. As far as mental health, so every employee at Atrium Health is eligible for the Employee Assistance Program, which is 6 mental health counseling visits a year. If you need a higher level of care, a different care, they will refer you out. And we schedule the first appointment for all of our residents in the first 2 to 3 months of residency, just depending on what rotation you start on, just to make you aware of that resource and in recognition of that difficult transition to residency. We do have a couple of interesting individualized curriculum options. So everyone does a longitudinal rotation that is either advanced advocacy, global health, or an office-based preceptorship, where we'll place you in the office of your choice. That can be Gen Peds, it can be a subspecialty, or it can be an inpatient or ICU with the same doctor. And so you'll really see what their practice is like over the last 2 years of your residency. You'll get an excellent letter of recommendation for your fellowship, or an excellent career mentor. And it's a really great experience for our residents. If I had to summarize our program in 3 words, it would be collegial, inclusive, and supportive. I do want to take a second to talk about our DEI work. So we have a brand new vice chair of DEI, and she was just named like a week ago. And I'm so excited that it's Dr. Dixon. She's been the director of our adolescent clinic for a couple of years now. And she brought and really delivered our Health Equity Grand Round series, which is in its 3rd year and is up and running really well. So I'm excited to see what we can do with her leadership, but she's going to be excellent in that role. And I'm just excited for the year to come. I'm going to pause. It's been about 4 minutes and 30 seconds, and I will pass the torch to the next program.
Thank you. Our next program is Wake Forest University School of Medicine. If the representative could please unmute and tell us a little bit more about them.
Good evening, everyone. My name is Elizabeth Halverson. I'm the program director here. I am actually working nights tonight, so I stack the deck with program representatives in case I get paged away. So I have my 2 APDs, Kimberly Montez and Chad McCullough are both on, and one of our chief residents, Lauren Tapp. So they will all tag team with questions later on. But I'd love to tell you a little bit more about our program. We are medium sized. We have 14 categorical peds residents and 2 child neurology residents per year. And there's really 3 things we'd most like you to remember from tonight. 1, we have incredibly strong clinical training with very few fellowships, so that allows you as the resident to really take the lead on direct patient care. 2, we're well known for our strength in advocacy at both the faculty and resident level. And 3, we're a very tight-knit, family-friendly community, and we'll provide you a little more detail about each of these as we go. So first, clinical training. Our resident inpatient rotations occur at Brenner Children's Hospital, which serves a large multi-state catchment area, features a level 1 pediatric trauma designation, a level 4 NICU, ECMO capability, and board certified faculty representing all of the pediatric subspecialties. Our excellent residents take excellent ownership of their patients and are given graduated autonomy throughout their training, so that our upper levels are really running the show, managing the care of some very sick patients. Continuity clinics are held at the Downtown Health Plaza, which is certified as a level 3 patient-centered medical home and is strategically located in a medically underserved area. As a result, residents care for a diverse and under-resourced patient population, in which 67% identify as Hispanic and 25% as Black. We also have a large immigrant and refugee population. Non-English speaking patients account for 44%, and over 90% of this population has Medicaid. We prioritize a true longitudinal experience in continuity clinics, so residents at every level are relieved of their other clinical duties to attend their clinic throughout the year. They're assigned to one clinic day during their time with us, so they build really close relationships and some friendly rivalries between clinical days with the other residents and faculty who are out on that day. So because of these relationships and because of the importance of patient continuity, we have no plans to transition to X+Y scheduling. To best address the needs of this unique patient population, residents build skills to screen for and address social drivers of health, right alongside learning the medicine. So we have wraparound services and resources available for patients with active partnerships with many community resources that are co-located in our clinic. These include WIC, behavioral health, lactation support, parenting programs, and subspecialty consultation services. Our graduates have a 97% rolling board pass rate. On average, half pursue general pediatrics and the other half pursue fellowships, and we have really excellent match results that you can see on our website. I'd like to turn it over to Kimberly Montez if she is on.
Good evening, everyone. I'm Dr. Kimberly Montez. I'm Associate Program Director and Vice Chair for Justice, Equity, Diversity, and Inclusion at Wake Forest. And the second aspect of our program that we'd like to highlight is our advocacy curriculum. Our program realizes that pediatric care involves more than one-on-one interactions in the hospital or the clinic setting. We feel that all residents, regardless of future specialty, should be empowered as lifelong child health advocates. Therefore, we don't have a specific advocacy track, but instead, our 3-year longitudinal advocacy curriculum exposes all residents to our community's child health inequities and builds skills to address these inequities through experiential activities and the development and implementation of a mentored advocacy project. The advocacy curriculum is also comprised of a windshield tour during orientation, site visits with community partners, home visits with patients, didactics that incorporate social risk factors and racism, bias, and discrimination, self-directed modules, and journal clubs. Several of the advocacy projects have been disseminated at regional and national conferences, have received funding from the American Academy of Pediatrics, and in the last 2 years, one of our residents received the Ann E. Dyson Child Advocacy Award from the American Academy of Pediatrics for his project on screening and referral to the Child and Nutrition Program, WIC, which was published this month in Pediatrics. So check that out. Furthermore, several of our faculty have regional and national recognition for their advocacy efforts and are highly invested in mentoring the next generation of child advocates. Third, and finally, we strongly value the community presence within our program. Our program is large enough that we can absorb coverage needs for any resident emergencies, but small enough that residents and faculty really get to know each other on a personal level. We have multiple mentoring relationships built into the program, but we found that many mentoring relationships come organically because of the nature of our community. We have a PhD psychologist who's focused on resident wellness as a member of our leadership team, in addition to an invested faculty member with a doctorate in psychology and a residency wellness committee, which is led by our faculty and residents themselves. Within ACGME requirements, we try to ensure our policies are family-friendly as possible. We offer a parenting elective to all of our residents and have presented several innovative components of that elective at recent national conferences with great feedback. Finally, we know some of you may not have heard of Winston-Salem, but we think it's a hidden gem. Known as the City of Arts and Innovation, it features 6 colleges, including 1 historically Black college, 75 recreational parks, and 33 wineries, while maintaining a small town feel. It's ranked as 2nd among the most affordable 100 largest U.S. metro areas, with a cost of living nearly 15% below national average, allowing your resident salary to go farther than in many other cities, such that many of our residents buy homes. And lastly, Winston-Salem has recently passed LGBTQ+ inclusive non-discrimination protections and is very LGBTQ friendly. Our health system has been recognized as the LGBTQ health equality leader by the Human Rights Campaign. Overall, we're very excited about our program and feel that we offer excellent clinical and academic training in a supportive, family-friendly, close-knit environment. And we look forward to meeting many of you throughout the season. And I will pass it on to the next program.
Thank you, Dr. Montez. That was very informational. The next program for the night is University of North Carolina. I would like to invite your representative to please unmute and tell us a little bit more about you.
Hi, y'all. My name is Meg Kilstrom. I'm the program director at UNC, and there's a few folks here with us tonight. We have our one of our program coordinators, Deanie Nemours, Christian Lawrence, who is our APD in charge of recruitment and the advisor for our first year class, and then Xavier Williams, one of our chiefs, is here as well. I'm going to stay on for the Q&A afterwards. So it's so hard to go after other people. I was like, oh, I should have said that. Oh, it's hard to follow other people. Anyway, so some of the things that we love about UNC is really the family feel that you have in our program. So we're a medium to large size program, having 24 categorical child neuro and PSTP residents a year, but really focus on making sure within that group that you know everyone, you know their story, you know who they are. One of our chiefs this year took all the residents their favorite snack on their first day of work to really help welcome them, make them feel like they were here. And as well as it's really interesting to see what some of these people's favorite snacks were too. Anyway, more about UNC and Chapel Hill. So Chapel Hill's right in the middle of the state. Chapel Hill itself is a small college town, but then outside of that, you can really make the area what you want it to be. Most of our residents live in Durham, which is about a 15-minute drive and is really more of a suburban or urban feel, depending on where you live in the city. You can also live 20 minutes outside and really be more in a rural area outside of Chapel Hill. So really the opportunity to make this area what you want it to be in terms of where you live, what community you live in as well. You can see on here some of the things about our hospital itself. So it is a level 1 trauma center. We are a busy hospital in the middle of the state with a catchment area that really is up to 3 hours or more around Chapel Hill. One of the things that is unique about our program is the opportunity to also rotate at other hospitals. So here you really get the feel at a tertiary or quaternary care center in terms of the subspecialty care, the exposure to all the subspecialists that there are within pediatrics, but also the opportunity to work as an intern and upper level at our two community hospitals nearby in Greensboro and Raleigh. You can do inpatient and outpatient experiences at those hospitals, see more of the bread and butter pediatrics. So see a patient with bronchiolitis, not bronchiolitis, with their list of other chronic medical problems as well, to really strengthen your abilities as a pediatrician, but also really helps with graduated autonomy. You work in the PICU at both of those hospitals as well, and then inpatient setting, and learn to really be comfortable being a team leader as well, which is something that our residents appreciate too. We also really focus on having an individualized program for our residents based on what you are interested in. So we meet with everyone to work on your schedule at the beginning of the year based on intern year on, what are your interests? What are your goals that you really want to do during residency, and trying to adapt to meet those as well. There are several pathways that our residents can do. A couple that are highlighted on here is global health. There's a global health pathway, also global health scholarship that several residents have had over the past few years. Physician scientist pathway as well. Just this year, we are this is our first cohort of a clinical ethics pathway as well, which we're really excited about. And then one for advocacy as well, that's called CHAMP. Xavier came up with the acronym. I can't ever remember what it means, but it's really cool. And we're excited about that one as well. Hopefully we're working, now I'm rambling, but we're working to hopefully be able to, with our School of Public Health, for our residents to get a certificate through the School of Public Health as part of that pathway too. Focus on wellness like other programs as well. While you are a resident, you will work hard, but it's also important as you are taking care of the children in our community to take care of yourself, to take care of your peers as well. There's some institutional resources for that through our hospital, which is taking care of our own, which offers longitudinal and acute care that you need, but also really supporting people outside of work, helping think through what are the things outside of work that help remind you why you want to do this job, what you can do each day to come back. And some of those are listed here as well. Similar, as someone mentioned earlier, we do not have the X+Y scheduling, but we have a mix of 2 to 4 week blocks based on resident feedback about which rotations benefit from 2 versus 4 weeks, and then dedicated subspecialty time and advocacy time during your first year, and then the subsequent years as well. And then one more thing to focus on, to highlight, is our diversity initiatives. And Christian's going to correct me where I'm wrong, because he's one of our APDs, but he's also the vice chair of our diversity committee. So several of the initiatives that we have right now, there's a longitudinal health equity curriculum that is resident originated and run as well, and is sustainably handed down from resident class to class. A visiting rotation that's named after one of our beloved HEMOC attendings. Through our DEI committee, so for the whole department, there are town halls, tea and equity sessions that happen every week, as well as our DEI grand rounds that happen every quarter. And then really focusing on mentorship as well. So several of our residents work with the School of Medicine and the undergrad here at UNC for mentorship, really encouraging the next generation of pediatricians as well. I think that's all I got. Christian, you can fill in whatever I forgot as well, but happy, excited for recruitment this year. It seems like it's so early getting started, and I know y'all are excited as well. So thanks for having us here tonight.
Thank you so much. Our next program for the night is Prisma Health, University of South Carolina, Greenville. If your representative could please unmute and share.
Hi, everybody. I'm Amanda Hartke. I'm the program director for Greenville, and I'm just loving the fact that all of us in the South, known for talking so slow and easing into conversations, are just getting all that information out to you. And I think that just speaks to how wonderful these informational sessions are, and getting you that piece of information, that feel of the program. So try to give you a little sense of our program. I've been the program director for about 3 years, about 6 years before that as the associate program director. We are considered a medium-sized program. We've historically had 11 residents in pediatrics per year, plus 5 med ped residents. We've just gotten approval to expand up to 13 residents per year. So we'll be looking at that option as we go into this particular year. And we are a hospital within a hospital, but we're really that resident-focused children's hospital. We only have one pediatric fellowship, and that's developmental behavioral peds. So no inpatient fellows. So our residents are right at that forefront of clinical care decisions. They're right on those first pass of who gets to have those procedural opportunities, but also really that one-on-one teaching with our specialists and our generalists. We have about 200 faculty that are just focused on being not only wonderful clinician, but really wonderful educators. And I'm lucky enough as a program director to be able to have to turn some away from giving lectures and from being part of what we call our mentor houses, which is both a resource of mentorship, but it's also really a social and community, both for our residents and their loved ones and significant others. So this is everything from it's a little bit of a friendly competition. Our residents are divided into 3 groups, so with an almost even number of faculty mentors that join in these houses. The competition is based on everything from a little extra points for you might have had a champagne tap, or you stepped up when somebody else felt like they were drowning in admissions, or maybe you just did a moment of self-care, whether that was a run on the trail that connects us to one of our rural communities just up the road, or whether that was truly just going and taking a nap. And you can report that too, because like so many of these programs tonight are saying, being a physician and training as a physician is also realizing what you need to have a sustainable career. So as we get to know our residents, as we have our residents enter that first time, we're going to ask, our chiefs are going to go through, what is your workforce appreciation language? Are you somebody that needs time, that you need a moment of space, you need an act of service? What is it that really, those words of gratitude, what is it that really fills your cup as you are pouring so much into all of your patients and all of your learning? So in terms of that learning piece, we really work to know not only your professional goals, but your personal goals. Are you headed back to the small town you grow up in, or do you want to be a program director one day? Where is that trajectory for you, and what do you need to get there? Is it a clinical experience? Is it a mentor experience? Is it presenting? Is it doing research or QI? We really want to put those opportunities in front of you, and then really those resources behind you to tailor what you need out of these 3 years. Now, life goes on during those 3 years. And so is Greenville a place is our Greenville? I know we have another Greenville up next. So is Greenville, South Carolina, where you would want to spend those 3 years? So a little bit about our city. We're about like somewhere on that upper edge of small town or small city, large town, about 70,000 people, relatively low cost of living, even for the Southeast. So residents can rent, can buy. It's easy to get rural pretty quickly. So you can go out of more of a place where you could bike to work to you can find a place where you could have land. So a little bit in between. Our city is very much growing with a lot of industries and a lot of visitors coming to our city. So there's always outdoor activities, entertainment, sports. There's a new restaurant every single week, and all of those mentor houses are diving into exploring those together with our residents. Our hospital itself is the only children's hospital in the region. We have a catchment area that includes parts of North Carolina and Georgia, and we have a very busy, the largest Medicaid clinic, pediatric Medicaid in the state. So high volume, high acuity, lots of resources. See what it would take to be a one-stop shop if that's your career plan. But we also have a secondary clinic as one of our longitudinal sites that gives those that are looking for more of a rural, under-resourced area and trying to see what would it be like to be a physician in those areas. Our population in our clinic self-identifies as approximately 30% Latino, approximately 30% Black, and approximately a mix of over 26 other languages as preferred speaking languages within our clinic. Our curriculum itself, like I said, is really designed to help you determine your own career path. The way we try to do that is give you a taste of as much as we can in that first year. So our inpatient general wards are not subdivided. You're going to have specialists walk up and talk to you and teach you about each patient on your list and have that mix and match across your census. We have pick you in our first year, nick you in our first year, and really get you that spread of what is sick, what is well, and what do I like. The same time, we're introducing you to all those faculty. The next pace beyond that, we, like some of the other programs have said tonight, we have considered X plus Y. For us, that would actually be less outpatient option. And we do that with a lot of intentionality, because for many, even those going into fellowship or specialty tracks and in their career path, they may be in an outpatient world, and we want you to see what that looks like as a career option. We also have a lot of breadth of options for medical educators, whether that is taking part in as our resident as teacher, where you are the preceptor for the clerkship students in our clinic as a third year, or teaching on the wards, or running the transition to residency boot camp for our medical students. So lots of opportunities to dive into the piece of medicine beyond the clinical that makes sense to you and really challenges you and excites you about your program. And then finally, we try to be very responsive to our residents. We have a monthly town hall. They absolutely give feedback. They look forward to it all month for all the things they tell me they want, whether that is new markers for the whiteboard or whether that is, I no longer want Q4. And so that is kind of how we ended up with our hybrid system right now. That's how we have changed and adapted each year. It's very, very much what the residents feel like works for them within our system. And I'm lucky enough to have leadership at the higher levels of our institution. My chairwoman was a former program director. Our over the DIO is a former program director. And these are all people who value residents, not just for the service they provide, but value our ability to educate them and launch them into the next step of their careers.
I am sorry to interrupt.
You're good. Too much time. But thank you guys for joining us.
Thank you so much. Our last program for the night will be East Carolina University. If your representative could please unmute and tell us a little about yourself.
Hey everyone, I'm Inga Ekman again from ECU. Thanks for the opportunity to talk with you all this evening. And it's good to see a lot of my fellow North Carolina colleagues and colleagues from the other Greenville as well, probably the more popular Greenville. But just a little bit about our program. So we are a medium-sized program. We have about 10 categorical peds residents every year, in addition to 6 med peds residents. So you have a small enough cohort to get to know everybody relatively well. Like many of the other programs, we don't have many fellows. We only have a NICU fellowship here, and so you definitely get first dibs on procedures, and also working directly with subspecialists in all areas, which is really great. You really have an opportunity to get to know faculty well, and they also have an opportunity to get to know you well over the 3 years that you're with us. We are the only tertiary pediatric provider in Eastern North Carolina. We serve 29 counties, so east of I-95, we are it. And we are a children's hospital within a larger health system, which does have its advantages in terms of collaborating with people outside of pediatrics for scholarly work. I think one of the highlights of our program is that we work closely with the Brody School of Medicine at ECU, and they're ranked among the top 10% of medical schools that graduate primary care physicians and those that practice in underserved areas. And that's definitely a core tenet of our program, serving the underserved and advocating for them. Some highlights of the curriculum. So we have academic half days, which are protected time, systems based for your board preparation. And then we also have a lot of unique conferences. So not just, our clinical case conferences and grand rounds, but also we have a monthly ethics conference, quality and safety conference that are led by residents. And we also have like a critical conversations conference every month where residents can debrief about difficult patient encounters that they've had over the course of the month. We have multiple wellness initiatives, and I'm really happy to say that our residents are kind of at the forefront of that. They've been very vocal about the things that they feel would benefit their wellness, both for things that happen within work and outside of work. We have a wellness committee, a social committee. Both of those are chaired by one of our junior chief residents. We have a pretty extensive global health program with annual trips to Zambia and Uganda, Haiti, when there's a less civil unrest there. And so we have very good connections with people in the global health community, and also have kind of a local global health program that our residents can rotate through over the course of their 3 years with us and earn a certificate at the end. Like many of the other programs as well, we have continuity clinic every week. It's not an XSY schedule, so you really get to know your continuity patients well and follow them over the course of your 3 years in residency and really form bonds with your fellow residents and the attendings that work within continuity every week. Some of the other highlights, so we also like to emphasize the importance of teaching as a part of being a resident and a medical provider. So there are plenty of opportunities to gain skills in teaching. We have an academic skills workshop and academic skills rotation that happens in the 3rd year, where you're precepting medical students during their 3rd year clerkship. In terms of scheduling, we work on a block schedule system, and then just to highlight diversity initiatives. So in addition to having a wide range of residents from multiple backgrounds, there's also safe zone training, bias training, and a lot of DEI initiatives through the Brody School of Medicine that we work very closely with. We are a very collegial program with a big family feel, and it's just been really great to see how well supported residents are of each other, and also the attendings that they get to work with. So happy to answer any other questions, but I think that's my time. So thank you.
Thank you so much, Dr. Ekman. That concludes the pediatric program overview session. We will now open the floor up for live Q&A session. I will ask the first question since we have questions coming in. This is for all the programs. Are there any opportunities for community engagement, like free clinics or community projects or something like that?
Yeah, you can do that during your scheduled required advocacy month. If you want a deeper commitment or something that's more self-driven, you can do the advanced advocacy program and do that here in Charlotte.
We have a specific community pediatrics rotation that occurs during the first year, which is really well established. I did residency at ECU too many years ago, and it was kind of in progress when I was there. We also have a clinic that's run through our homeless shelter that some of our residents volunteer at, and that's a longitudinal opportunity that you can take advantage of.
As I mentioned at Wake, we have a longitudinal advocacy experience. We have a 2-week rotation in intern year, 2-week rotation in the second year, but we also have a mentored advocacy project. Those have been really impactful. And again, some of them have been disseminated regionally, nationally, and in the literature. So for example, we had a resident who partnered with the Period Project and we started screening for period poverty in our clinic, and we are about to write that one up. I mentioned the WIC project. We have other projects working with schools and educating nurses regarding medical emergencies in schools. So lots of community engagement possible at Wake.
In Greenville, oh, I'm sorry.
No, go ahead.
In Greenville, South Carolina, we have embedded in our advocacy in our clinic months throughout all 3 years. You have protected half days to go out and do site visits with various community partners, as well as work in school-based clinics and with our Department of Juvenile Justice. And you can take an additional month in your 3rd year if you would like to further extend the advocacy project you do as an intern.
Thank you. The next question would be about what kind of research do residents engage in during residency?
I can start with that one. I think it really depends on the resident's interest. Coming in the door, similar to what other folks said, really supporting you and what you want your future to be. So there's an opportunity. It's hard to do bench research in residency, as I think most will agree based on the schedule, but there is an opportunity for clinical experiences, especially data review, to do those. Quality improvement, education, med ed research is definitely an opportunity a lot of our residents take advantage of as well, but really based on what your interest is. I think there are resources at most institutions to support you doing that.
Yeah, and to that point as well, Meg, we have our whole research track. So if there are residents who want to get even more involved with research and want to have more robust opportunities, there's opportunities for that as well.
At Wake, we added a scholarship requirement a few years ago, so residents have to disseminate their work somewhere. That can be to greater or lesser extents, depending on the resident's interest. But we actually have a committee of faculty who are assigned as coaches to each resident, assist them in finding a mentor within whatever domain they're interested in working in. So can be clinical research, but also medical education, can use their advocacy project for this, could do QI work. So a variety of interests, but that coach helps them find a mentor and then helps sort of troubleshoot issues with the project as it goes along throughout their 3 years of training.
Yeah, similar at ECU Health, we have, or I guess, chair of pediatric research that meets with all of our interns during their career development rotation to kind of help them navigate and think about what they want their scholarly work to look like.
Thank you. The next question is if you could please elaborate on how you prepare the residents for the next steps of their medical journey, like fellowship and attending, or if somebody's interested in education, and like what are the teaching opportunities, things like that.
So that's a very broad question, but I guess I'll take a stab at it. So in my role as APD, I'm one of the advisors for our first year class. And one of my jobs is to literally sit down with every one of our residents and figure out what it is they want to do and be able to support them in that. Now, of course, I can't be a mentor for them in every one of those roles. So part of me is being a middleman and figuring out how to connect them based on their unique goals and what they hope to do with their career. Thankfully, we have a lot of different opportunities within many different realms: research, medical education, advocacy, all of the things that you may be interested in. But we work very hard to make sure that we pair people up with people who are going to be able to support them and mentor them, sponsor them, and just make sure that people are successful, and then match them up with different opportunities, whether that's locally or nationally, and getting people involved. Xavier, who's on this call, one of our chief residents, can probably speak to us, trying to pair them up with different opportunities and making sure that you're successful in whatever you need to do.
We also interpret
Oh,
the.
sorry. Go ahead.
Go
Sorry.
ahead. Someone else going?
No.
I'll just say we also interpret the individualized portion of the curriculum as career development components. So we actually have 7 different pathways that align with different career plans. So we help, and that comes with mentorship. So those mentors meet with the residents, help them craft their schedule to actually make sure that they're meeting their needs, not just what they think they might need, but also what faculty in that area actually do, and say we're either most useful in their training or what they wish they'd done in training. And then along with that, the elective, so that's their pathway time. Elective time can also be used to explore, especially some of those more academic opportunities. So we have a med ed block. We have pretending blocks in a variety of fields to let a resident sort of step more into that role of being an attending in their final year of residency, can do a research block, that sort of thing.
Perfect. Another question we saw in the chat was, if your program would have a theme song, what would that be?
Dolly Parton working 9 to 5. Next question. No, I'm just kidding. And yeah, that's our choice. Dolly Parton 9 to 5 for sure.
Love that. Any other program want to answer that?
Chad, I'm gonna say it before you do because I'm scared for what he would say. But I think Wake Forest would be "This Must Be the Place" by the Talking Heads.
I'm gonna be super cheesy, but We're All in This Together from High School Musical is probably ours at ECU.
All amazing choices.
At Prisma Health, we recently joked that we have absorbed the affirmation song by Snoop Dogg, of like I get better every day, my feelings matter, and a lot of the things that lift us up on those hard days.
Those are all amazing choices. One more question for the evening would be, what are the wellness initiatives that do these programs offer?
I was going to say that I feel like wellness is such an individual thing, and what feels like wellness to one feels like another ask to someone else. So I think it really starts by just saying, like, what is it you need? We have people that if you give them more time off, they're going to feel more stressed because they think they've not done something else. But if you ask them, they're like, I just really want to go sit in the sunshine and read. And so wellness to us is protecting time and protecting administrative time within the workday so that when you go home, you're really at home.
Yeah, I think it's both, right? I think you have to, like, everyone who's practicing medicine is trying to figure out wellness and how to cope with a system that takes perfectionists and puts them in a broken system that requires more of them and is kind of impossible to beat. So I think learning how to cope with the realities of medicine, but also realizing that residents work every day and that's not really healthy. So administrative half days once a quarter, truly protected time for mental health, allowing your residents to get to physician appointments. I think that's wellness too. And you want to go to a place that does both of those things.
Just to speak from UNC's perspective, I'm one of the chiefs. I think wellness can be seen in a variety of ways, just as was just mentioned. There's a lot of structured ways in which we can talk about wellness, and having lectures and having opportunities to kind of talk about how we manage with our stress and feelings. But I feel like especially amongst the chiefs, we do a really good job of trying to make sure we foster environments where people can really kind of detach from the craziness of the hospital and really enjoy themselves. Pretty much each month we try to have we have a curriculum called Reset and Recharge curriculum that's helped that was helped developed with one of our ED attendings that essentially provides just different ways for us to kind of relax. We've had our Nintendo Switch kind of set up in our conference room, and we have a Super Mario Kart out there playing with some ice cream and stuff like that. There's times where we're outside and we're doing cornhole and just really trying to relax and hang out with one another. And then the other thing with that family atmosphere that UNC really brings, a lot of what you'll see in the wellness is outside of the hospital, especially, and how our residents really get together and build that community amongst each other. There's so much stuff to do around the hospital, but especially outside of the hospital. And so you see a lot of that wellness built that way.
Thank you for elaborating. Before I let the program directors go, I want all the program representatives to tell me one fun fact about their program. Or their favorite parts of the program.
A ton of our faculty come back. So a lot of our faculty go off to fellowship and come back. So three of my classmates are on faculty and 2 more are in the community and primary care.
Similarly, I would say, fun fact, UNC is kind of a black hole. Dr. Kilstrom says it all the time on interview day. It's like a black hole because once you come here, you're kind of stuck. People stick around forever. A lot of our leadership team has been here forever, similar to Atrium. People may leave, but then they come back, and it's really cool because it's almost like being reunited with your brothers and sisters and your cousins and your aunts and uncles. We're all part of the Carolina family, so it's a lot of fun.
I think we are, one of the things I love about it is we are first name basis everywhere from the chairwoman to the environmental services that is coming to make sure that the trash gets taken out, because each of those people has a voice in patient care and in our training.
We do, my favorite program tradition that's been going on since I did residency here was we do a roast every year. So the first and second year residents roast the third years. This used to be, this has evolved over time and is now this incredibly elaborate video. Last year's class, it was like a 45-minute production that was absolutely hysterical. But my favorite part is at different points in time, the third year class has roasted the faculty. That hadn't happened for a few years with COVID. And so it just started up again this past year, and they roasted just us as faculty representatives. So Lauren, who's on, actually played me in the roast this last year and did a better job than I could have done myself.
Yeah, we also have a lot of faculty that were either medical students at Brody or residents at the either med-peds or peds programs, and that's been fantastic. Our White Elephant Christmas parties are legend, and it's really great when children of faculty and residents come every year. You've kind of seen them grow and how competitive they are for White Elephant presents over the course of the 3 years. I had one of my colleagues, like children, stare down one of our second year residents, is like, I see you, I got you, I'm gonna get that gift from you. So again, just that family feel of the program is you know, intangible. It's something that just kind of permeates. I'm really happy to have that as part of our culture.
Perfect. Thank you so much, everyone, for telling us about your program. And thank you for coming here and representing your program. We will now kindly ask our program directors to log off as we transition into the resident panel portion of the evening. Students and other participants, we ask that you stay on if you have questions for the residents.
Join. Welcome everyone to room 3. My name is Denise Cruz. My pronouns are she, her, and I am a 4th-year medical student from the Alabama College of Osteopathic Medicine. I will be your moderator this evening, and I will also like to introduce our FPR co-director, Catherine Geico. She should be in here as well. She'll be working behind the scenes tonight, and I am your associate director of webinars. So if you have any questions, feel free to put it in the chat. I would like to invite our program representatives to give a short presentation of their programs for 5 minutes for the first part of the evening, and then we'll take questions after all of the presentations. Attendees, you can, however, leave your questions in the chat as we go, and we also encourage programs to make use of the chat to answer any questions that you see in case we run out of time. And as soon as the program directors start, I'll go ahead and start a timer. And with 1 minute remaining, I'll notify the presenter just very kindly. And without further ado, our first program of the evening is Emory from Atlanta, Georgia. Go ahead and introduce yourselves, unmute, and tell us about your program.
Hey everybody, I'm Rebecca Sanders. I'm the program director here at Emory and at Children's Healthcare of Atlanta. And I'm joined tonight by my chief residents, Dr. Vidya Menon and Dr. Bailey Bennett. We just want to tell you a little bit about what we're really excited about our program. Some of the things that I think set Emory apart, besides being in Atlanta, which is an amazing city to live in, is that we have 3 different hospitals within our children's hospital system. So you get the opportunity to train in 3 different freestanding children's hospitals, one of which is very small and only has 24 inpatient beds, one of which has about 280 beds, and one of which is brand new and set to open in 2024 and be a state-of-the-art, beautiful facility. You also have the opportunity to train in a large publicly funded safety net in Grady Memorial Hospital. That's where you would do all of your newborn nursery and NICU time. So you get this incredible depth of experience. We aren't charged with providing coverage for all of these hospitals. Instead, they're there for you to pick and choose the best opportunities from each of them. So you really get the best of patient mix, patient complexity, and we see patients with a wide variety of cultural backgrounds. 15% of the individuals in Atlanta were born somewhere other than the US, ethnic diversity, and then also just an incredible place to live and experience all of that culture. We also have the largest or the 3rd largest LGBTQ plus population in the US. So you get exposure to so many wonderful things. It makes it a wonderful place to live. And we have over 400 faculty and all the resources of both Emory University and Children's Healthcare of Atlanta to help support you in your individual career goals. So anything that you want to do or become in the future, we can help make happen. And I don't know if my chiefs want to add anything.
I'll talk a little bit about kind of our diversity initiatives. So I'm one of the co-chairs for our diversity committee. And I think it's one of those things that really attracted me to Emory was that it wasn't just, they really prioritize their diversity initiatives. And from day one as a resident, we really emphasize that through our longitudinal diversity curriculum, which residents have the opportunity to engage in and update through the year. And we also have the ability to participate in the Emory GME-wide diversity committee space. And we have lots of faculty mentorship through the faculty diversity committee as well. And we also do health equity rounds, as well as diversity socials. And one thing that we're working on this year is instituting a DEI journal club. And Bailey, if you want to talk a little bit more about some of our educational tracks.
Hey everybody, my name is Bailey. I'm one of the other chiefs with Vidya. So I wanted to talk about a little bit of our pediatric specific tracks. So we have a new one that we're super excited about called the Pediatric Equity Advocacy Community Health, Environmental and Social Justice, or PEACHES track. A little bit easier to say, but it's a 2-year track that focuses solely on developing local, state, and national advocacy skills. And it allows you to collaborate with community organizations and leaders, and go to the AAP Legislative Conference or other similar conferences. And then other things that we're super interested in are our new prize track. So we are #1 ranked in NIH funding for research. So we have a lot of residents super involved in research. And we're excited that one of our tracks, the prize track, which stands for the physician, Prize Plus is what I'm talking about, but there's the opportunity to get involved with an R38 pathway, or the integrated research pathway, or the accelerated research pathway. The R38 is super exciting and gives you a chance to get about $40,000 in research funds over the course of your program. Just to call it, it's the Pediatric Residency Investigative Scholar at Emory track. And those are just a few of the wonderful things that you'd be able to have the opportunity to get involved with at Emory. And I don't want to take up too much more time. I know we're close.
Awesome. That was perfect. Thank you so much, everyone from Emory. I'm going to go ahead.
That I want to add is that we're going to have a virtual open house and a diversity first look in the next couple weeks. So stay tuned for that.
Perfect. Sounds great. Thank you so much, everyone. I'm going to go ahead and move on to the next program. We have Medical College of Georgia. So whoever the program representative is, if you'd like to unmute and talk about your program, we'd love to hear about it.
Hey y'all, I'm Lauren Newcall. I'm the program director here at MCG, and I'm joined tonight by one of our amazing PGY3s, Dr. Sarah Straka, and one of our great PGY2s, Dr. Ben Gorian, who will be around to answer a few questions later on. A little bit about our program. We're a medium-sized program. I'm glad to follow our friends down the road in Atlanta. We're right down the road on the border between Georgia and South Carolina. We are housed in the Children's Hospital of Georgia, which is our primary site, and that is a university hospital. It's affiliated with the Medical College of Georgia, which is the only state-funded medical school in the state of Georgia and one of the largest medical schools in the country. So there's lots of opportunities for residents that have an interest in student education to get involved and meet some real leaders in medical education and gain some skills there. In addition to our primary site at CHOG, we also have a smaller hospital, community hospital across the river in South Carolina, Aiken, where we do our newborn nursery rotations. It's also where we do some of our outpatient rotations. That gives residents the ability to build a little bit of autonomy, to have the opportunity to really be the pediatricians in charge, especially during overnight shifts there, being able to attend deliveries, and really build the confidence needed to be able to have a career in a community practice site and build those really great skills. Here at our primary site at CHOG, we have all specialties represented, including palliative care and genetics. So there's opportunities for residents to be able to do just about any rotation that you can imagine. We also offer quite a bit of individualized curriculum time for residents to build their own rotations and really make it what they need to get what they need for their career. All of our residents knew in the past couple of years was we've really been putting a focus on scholarship and offering residents abilities to do projects that are meaningful for them and their future careers. So now every resident coming in is assigned a primary research mentor. That's based on research interests that residents kind of tell us as they're coming in. We partner you with a faculty mentor from day one. That pairing is tasked with coming up with a project together with the goal that that project will be able to be presented in some form or fashion before you complete residency. We have program and department funds to get residents to meetings to present their scholarly work, and we want to be able to provide that for every single resident that comes through our program. Another new kind of opportunity that's come up recently is academic half day for us. We've recently switched our didactics in the past year over to an academic half day. So we have morning reports about 3 mornings per week, grand rounds every Friday, and then academic half day every Tuesday afternoon. This is an opportunity for every single one of our residents to be excused to attend didactic sessions. During those sessions, we cover, board review topics. We cover some interdisciplinary sessions with our pharmacy and with nursing. We cover ethics. We also have our procedures and simulation curriculum built within that time. We do some of that on campus in the hospital. We also have access to the MCG Procedures and Simulation Center, which is a state-of-the-art 40,000 square foot simulation center, which is just right down the street from our hospital. That gives residents access to a lot of great technology to be able to learn the skills that they need. Our program is really interested in hearing what our residents have to say, and we really try and make sure that the changes that we make in our program are really centered around our residents and their learning needs. So we have a monthly meeting with myself and the rest of the leadership team. We also have a monthly breakfast with our chair where she comes and talks to the residents about everything going on within the department and the hospital system. She answers questions and she shares with our residents the same things that she shares with us at our faculty meeting so that everybody's on the same page and knows exactly what's going on in the hospital. We knew this year we're rolling out a new well-being curriculum. We have a new faculty member coming on who's going to be helping the residents work on individualized projects and kind of self-work, which is really exciting. And we're also rolling out a new global health curriculum during our academic half day that we're excited to share with our residents. We will be, if you want other opportunities to chat with us, we will be hosting, along with the rest of our GME programs at MCG, a DEIH webinar on Saturday morning. And you can find that information on our social media, how to sign up for that session. And we're also planning for an open house later this fall for any other questions y'all might have. I think that's everything.
Perfect timing. Thank you so much. Next up, we have Broward Health Program. Go ahead and unmute. The floor is yours.
Hi, everyone. Good evening. Welcome. My name is Dr. Christy Rivers. I'm the PEDS Program Director of the Broward Health Sala Foundation Children's Hospital Residency Program. And I'm the Assistant Medical Director for the Pediatric Hospitalist Program as well. You'll get to meet 2 of our third years at the Resident Happy Hour, and you can ask them any questions that I don't go over. I'll start by telling you a little bit about Broward Health. Broward Health is one of the 10 largest hospital systems in the country, and we are a safety net hospital. So basically that means that we take care of anyone who walks through our doors regardless of their ability to pay. Our hospital is located in downtown Fort Lauderdale. So because of that, the location, we're close to the international airport. We're very close to the cruise ship ports. We're close to the Caribbean islands. And so consequently, we have a very diverse patient population. And that really allows us to have some extraordinary pathology at our program. We are a fairly small program. We have 8 residents per year. But I think that is one of our strengths that really allows us to get to know our residents really well. And then it allows us to provide strong mentorship to our residents in a really individualized way. We do not have fellows, so that also, I believe, is an asset to our program in that our residents don't have to compete for patients, don't have to compete for procedures, and basically it allows our residents to have a lot of autonomy when they're caring for patients, whether it be in the ER, in the NICU, PICU, where they're able to get a lot of procedures. We have a wide exposure to primary care and our outpatient settings. We have 4 different clinics that our residents rotate through for continuity clinics. And then they also have, of course, exposure to the critically ill patients. We are a level 1 trauma center. We're a level 3 NICU as well. We're not affiliated with a medical school, but we do have partnerships with 3 different schools in the area. So Nova Southeastern University, Florida International University, and the University of Miami. And so that allows our residents to develop strong teaching skills. It allows us access to some of their programs and faculty as well. Advocacy is a really important part of our mission as a program. So we take care of a lot of low-income patients with a lot of unique needs and challenges, and our residents are able to learn how to navigate that during their time as residents. We do have a 1-month advocacy rotation. We've had that for the past several years now, and that really allows our residents to get out into the community and to engage and learn about the resources that our community has for those patients. As far as our residents, about 1/3 to 1/2 of them go into fellowships. So even though we're a small program, our residents have been very successful in matching to top programs all over the country. We also have recently switched to an academic half day. So we have that every Friday afternoon. That is protected didactic time where the attendings, if you're on the inpatient teams, will take care of those patients while our residents are in didactics. And then we have noon conferences a few days a week. We have grand rounds, a case conference, journal club, et cetera, at that noontime hour. Our residents have a lot of opportunities for presenting both locally and nationally at different conferences. They are involved in the Florida chapter of the American Academy of Pediatrics. Every year we have residents who attend the National AAP presenting posters as well. And we do have a lot of involvement with QI projects and research projects. So even though we're a small program, we do allow our residents lots of opportunity for research there. We take resident feedback very seriously. We have monthly resident meetings where the program leadership meet with the residents. They're able to express any concerns, talk about what's going well, and we're able to get a lot of feedback and incorporate that into changes that we make for our program. We also have some longitudinal curriculums. We take wellness very seriously at our program. We have resident retreats. We have wellness days for our residents. And we have a gym on site that our residents have free access to. Some of the other longitudinal curriculums include the business of medicine and other quality improvement longitudinal curriculums as well. We have an open house coming up as well as a underrepresented in medicine open house. Both of those are coming up in September. So look forward to seeing some of you there where you can learn a little bit more about our program. Thank you.
Awesome. Thank you, Dr. Rivers. Next up, we have University of Miami, Jackson Health System.
Hi, everyone. My name is Payal Shah. I'm one of the associate program directors of the University of Miami Jackson Memorial Program. I'm joined alongside by another one of our APDs, Dr. Donna Wiener, who's been a part of this program for, I just learned, 27 years. We're both really excited to be here today and tell you more about the program. We're a mid-sized training program at a large academic tertiary care center, providing care to the underserved community in Miami-Dade and the citizens of many neighboring countries. So this landscape really provides for unique training opportunity for our learners where they get to see everything and do everything. We're a very hands-on training program, and we are actually a very resident-driven hospital. So most of our service lines are covered by residents. Therefore, you get to see a wide breadth of pathology and get good hands-on training with procedures. We also like to take diversity one step further from our patients to our resident body. So it's a longstanding tradition in our program to have our residents kind of mirror the patients we serve. And for that reason, we've always had a very diverse resident body, which I think is very unique to us. So if you look back 20 years, you'll always see diversity kind of at the core of who we are. Through our unique partnership of Jackson and University of Miami, we have a lot of great scholarly activities that go on between advocacy, QI, as well as basic science research. And we really want our residents to find their passion, to find their love, and we'll help foster that in whatever way we can. We have carefully devised our curriculum to allow for graduated autonomy. We really want to graduate a resident who is well-trained, well-rounded, and confident. Therefore, a lot of the curricular decisions we've made are always surrounding graduated autonomy. So we want to put you guys in real life situations to get you guys ready to be a pediatrician. Other than that, at the core of who we are is family. We always say that the common thread that guides all of the staff, residents, and faculty together is kind of our love for caring for our patients and how we serve them. We strive to provide equal care to everybody, regardless of their ability to pay. Our faculty at our program are very unique. They're excellent mentors, and they really lead our residents by example. Residents are very well prepared for life after residency, whether it be they want to pursue fellowship, often matching in their first choice, or any other outpatient pediatric experience. Other key pieces to our program are that we are on block scheduling. All of our residents are now housed in our resident-run continuity clinic at Jackson, as well as we have UHealth private sites where you get a more private practice general pediatric experience. Dr. Weiner, did you want to add anything?
No, it's just that, you know, you hear every program, and when you hear about every program, you want to join every program. So for all the students who are looking, I'm sure this is a very complicated choice that you have. I think the difference with us, as Dr. Shaw said, is because we're mostly serving the underserved, it takes people who are really caring, who want to make a difference, who are down to earth, and that's going to be your family. Your fellow residents are going to be your best friends, and you're going to come on out being prepared to do whatever it is that you want to do. One of the things that I'm also very proud of, other than the fact that almost all of our residents who do go into fellowship get their first choice, is that it's been very varied. Every subspecialty that exists, our residents are in. That subspecialty will have had a resident go into it. So you are exposed to everything, but you know, every place has a different personality, and this place really does feel like a family. People really take care of each other. And we also have
then Miami is a great city.
Right. And we also have everything that's been mentioned.
I just want to speak about Miami. I have been here to witness the change of Miami over 18 years, and it's incredible that there is a neighborhood for everybody. So it's a really unique place to come visit. We're going to have a webinar coming up. We would love for you guys to join to learn more about us, and please follow us on social media.
Awesome. Thank you both so much. Let's move on to our next program of the evening, University of South Florida, Morsani. Go ahead and unmute. We'd love to hear about your program.
Hi, thank you very much for having us tonight. My name is Sharon DeBrow. I'm the program director, and I'm joined by Kelly Paulina, who is our program administrator, and then my two chief residents, Ivy Wilson and Andrea Lafnitz-Sager, and they'll be on the breakout room later. So for the students on tonight, this is really hard listening to every program and trying to figure out the differences, because the bottom line is we really all care about kids, and we all really want to teach you all how to be the best pediatricians. And that's the same thing that we want to do here at USF. So what makes us maybe a little bit different is that we have two hospitals. One is a freestanding children's hospital, Johns Hopkins All Children's Hospital, that our residents do rotations through. And then we also have a very large 1,000-bed city hospital that has a pediatric floor, a PICU, and ER at Tampa General Hospital. And you guys, our residents, get to work at both sites for different rotations. So you get an experience with two different kinds of hospital settings, and therefore different kinds of patients. We also have a Med-Peds program, which I think is a pretty cool opportunity for you to work directly with those residents. We have 12 categorical pediatric residents per year, and then there's 5 MedPeds, and they are integrated very much into the pediatric program and really do bring additional diversity in their knowledge and expertise to our program. As far as the population, we, like was said before, try to mirror our patient population with our resident population. And we are a mix in Tampa Bay. We have a large Hispanic population, African-American, Caucasian, and then folks, really patients from all different areas in the world. But we really do value diversity in our patients as well as in our residents. We do offer electives in all 3 years. So in the first year of residency, you get a core elective, and then second and third year, you can build on that. And we do hope that it is based on your individual goals and career aspirations. We have our tracks are based on that internally. We also have a pretty unique opportunity in your second and third year to do a second longitudinal clinical experience, or as some of us like to say, second clinic. So if you're interested in hospital medicine, you can spend an extra half day a week, second and third year in the hospital or in the ER or in a subspecialty or even in a private office. And that gives you a little bit more mentorship for that field that you might want to go into. We have this similar conferences to many other programs. We have an academic half day that's dedicated time Tuesday afternoons between 12 and 5, and then morning reports and grand rounds and the other kinds of conferences that we've talked about. For wellness, we have a wellness committee and also take wellness very seriously, even though it sounds like wellness shouldn't be taken so seriously, but we have a lot of opportunities for folks, as well as a residence assistance program that provides psychological and emotional support for our residents if needed. And we actually have all of our residents have a visit with them right when they start in July or August. Both of our hospitals allow our residents a great deal of autonomy. And to me, that's one of the greatest things about our programs is you really do get to learn how to be a doctor. You're often alone at night with support by phone, but you don't always have another physician there with you aside from your colleagues. So we don't always have an attending in-house. And I think that actually makes for a stronger residency program. Advocacy is a big part of our program. I happen to be the advocacy director and also the AAP liaison. So we value advocacy a lot. And we have had residents go to the national AAP meeting and also provide leadership for the Florida chapter AAP. And lastly, before I let my other folks on the call add to this, we're in Tampa Bay, which is a great place to be. If you are interested in sports, if you're interested in the beach and outdoor activities, maybe not in the heat of the summer, but most of the rest of the year, it is really a wonderful place to be. People live both in Tampa and in St. Pete and in the surrounding areas. And it really gives you so many options of things to do and things to enjoy when you're not at work. So I don't know if Kelly or my chiefs have anything else you want to add.
I'll just add, I'll just add quickly that I've heard it. I just want to echo what other programs said. We really are a family community, and it's so exciting being able to, share these experiences with the residents as your coordinator. So if you have any questions, just reach out to us. But you'll get to see our amazing chief residents during the happy hour portion. But we look forward to hearing from you.
No, Dr. Brown, you did it perfectly. I feel like I can't really add anything other than echo what you already said. But yeah, I am Andrew, one of the current chief residents. And yeah, I think the longitudinal clinic is definitely a highlight for our program. As someone who's interested in adolescent and mental health, I got to do 2 different clinics throughout residency, one being at our nonprofit Ybor Youth Clinic, which is kind of parallels Planned Parenthood in some ways, where you help provide free sexual education and STD testing and things like that. And then I also got to help out with child psychiatrists and help with nonprofit Medicaid visits with pediatricians for psychiatric visits. So there's definitely really cool niches that you can get into as well. And they're very supportive of that.
Awesome. Thank you so much. We are down to our last program. Going to go ahead and share my screen. All right, here we are, University of Florida from Gainesville. The floor is all yours.
Thank you. Well, you all are a hard act to follow. But last but not least, I'm Kendall Stedman. I'm one of the associate program directors at the University of Florida, located in Gainesville, so the center of the state. We are a mid-sized program. We have 18 residents per year. We do have a peds neuro resident as well, 2 each year. We've increased our size, but we are a very close-knit program. Our hospital is based out of Shands. It's connected to the University of Florida, so right on campus, the undergraduate campus. We are quaternary referral center, so we see a lot of pathology. Because we are a large medical center in the center of the state with not a lot of bigger cities around us, we have a large catchment area that includes Georgia, a lot of the southern states. So we see a lot of the zebras, but also a lot of the bread and butter, which is what really attracted me to the program. I was a resident here, I was a chief resident here, and I've stayed, and that's been almost 10 years ago. Actually, I started residency over 10 years ago. We do have 5 tracks. They're very well established. They started in 2011. So we have medical education, public health, research, primary care, and global health. So our residents typically really enjoy entering our tracks. We do focus on education. So we've transitioned to an academic half day about 7 years ago. And we offer med study to all of our residents, which we've had a really great success with our board pass rate. So we've had 100% board pass rate the last 3 years, which I don't think a lot of programs can brag about. So we're really, really proud about that. And we've had a 100% board pass rate the last 4 or 5 years. But we also have a lot of other perks. We have health insurance that's included, daycare. So if you have children, we actually have a daycare that's in the hospital. It's called Baby Gator. A lot of our residents take advantage of that has kids. As someone who sent their kids there, it is an exceptional daycare. We have a really robust SIM center. We have really good collaborative professional communities too. These are groups that kind of increase our wellness, increase our community with each other. So we do that. We meet with our CPC, our collaborative community groups, every Tuesday afternoon or once a month on Tuesdays. We have another few things that we can brag about is that we've received a lot of catch grants through the AAP, and then we have this really cool experience that I think I really enjoyed as a resident. We have an after hours program, which is gives you that experience of being in private practice, because a lot of half of the coverage is from our private practice pediatricians in the community. And so you get to work with them, see how things are run a little bit differently than we would through our university clinics. But we do have a robust continuity clinic as well. There's 2 main sites that our residents go to. You're usually assigned just one throughout your residency. A few other cool things, like Dr. DeBro had mentioned at USF, but we do have increasing autonomy throughout our training. So I think our residents are very well equipped to enter fellowship or go into primary care. About 50 enter fellowship, about 50 enter primary care. We had a really great fellowship match this last year. So they went to places like Boston Children's, Columbia, Yale, UT Southwestern. So we are really proud of where our residents are going for fellowship. Another fun thing is that we have resident retreats. So our interns go to an intern retreat. This last year was in St. Augustine. So we get the whole weekend off, and you do some program activities, but for the most part, you get to hang out with your co-residents. And then each year after, you get a day of retreat with your classmates. We are the University of Florida, so if you like college sports, this is definitely the place for you. There's many things to do, many sports to see. Because we're associated with the university, there's a lot of activities here. So it may seem like a college town in the center of the state, but there's actually a very robust kind of social scene here. I don't want to take up too much more time. So we have Dr. Mahmoud Jara. He is our chief resident. I was going to have him kind of discuss a little bit more about the program and see you guys had any other questions.
Thank you, Kendall. I'm Mahmoud. I am one of the chiefs. We have 2 co-chiefs this year. I was proudly trained here. We have really a comprehensive training. I just didn't want to repeat what Kendall said, but my wife was trained here. I was trained here, and we've been here for 5 years. I love the town. I love the supportive environment that we have in the program. I got to interact with 5 or 4 years classes before me. I have lots of friends. And I think it's location of Gainesville, one of the best things that I like about Gainesville, because it's within 2 hours drive from cool places. I think one of the things that we are going to add, establishing a mental health track for residency. I'm working on. We already have like really good curriculum for simulation, but we're trying to do more comprehensive integrated simulation in the pediatric education for residents, where we're going to have almost like 50 hours of simulation over 18 months curriculum. We already have established academic half day for more than, I think, around like 7-8 years now. She mentioned the board passing rate, which is we always brag about. Our residents, they do really well on the boards. And I think we will be so happy if anybody want to reach out, have any question for us. So we'll welcome you in the Gators town. We'll give you a ticket if you come in.
Awesome. Thank you so much, Dr. Jara. That concludes our program overview of the evening. We're going to now transition into our live question and answer session. So if anyone would like to unmute, introduce yourselves, ask your question. If you want to be more anonymous, feel free to message me directly, and I'll go ahead and direct that to the either program director or all the representatives that are here tonight. All right, we do have a question that is coming in. Someone would like to know what types of interdisciplinary activities are offered in all the residency programs and curriculums that are here now, because I know we do a lot of work in day-to-day life with pharmacies, nurses, social work, and everyone is a big part of the team and how they're involved in patient care. So if anyone would like to go ahead and unmute.
This is Sharon DeBrow from USF. I'll just add that we also have a master's in public health available. It's beyond interdisciplinary, I guess, because it's a different discipline, but that's available for our residents. They can get a certificate over their 2nd and 3rd year, and the tuition's free. So we're one of the few programs in the state that have an MPH program.
We also do at the University of Florida, so kind of the same. You get time to actually work towards your MPH, and you take those classes through the University of Florida.
Yes, the track at UF would count for 1/3 of the credit hours of the MPH that's get paid by the program. And even if you're not on the public health track and we have availability in those classes, you just need to apply for the program director, and usually we get people in those classes. And you get that as an elective time up to, I think, 6 months of your residency to go into that MPH program.
In regards
So
to incorporating
in terms of multidisciplinary or interdisciplinary collaboration, our residents on their inpatient rotations participate in formal multidisciplinary rounds with all members of the healthcare team. On some of our hospitalist rotations, it's either 5 mornings a week or 3 mornings a week, depending on the hospital. And then you also do that in our NICU and on rounds in all of our ICUs, in both our PICU and our NICU rounds. You actually have multidisciplinary patient rounds every day. So there's a pharmacist and a nutritionist who are with you on rounds in the NICU. and both nursing and respiratory therapy for each patient is at the bedside when you're at the bedside. And that's in both the NICU and in our PICU rotations. So we really try to model interdisciplinary care for all of our residents. There's also wonderful opportunities for quality improvement projects that have multidisciplinary focus. We feel really strongly that patient care does not occur in a physician vacuum, but that it requires collaboration amongst all of the individuals in the hospital. And for our residency QI projects, we choose things where we can identify key stakeholders from other disciplines. And have had nursing leadership and respiratory therapy leadership and other health professionals join us as part of those. And then when the hospital has quality improvement projects, many of which are driven by respiratory therapy or nursing, as well as by physician leadership, we make a point of including residents in those. And then in many of our subspecialties, there's also the opportunity to work with nurse practitioners or with physician assistants. So our pulmonary team has PAs, as does GI, and then our PICU and our NICU use NPs. And so you're working alongside them and get to sort of see firsthand what that sort of practice would be like if that's what you choose to do in the future.
Awesome, thank you. Another question came in about, I know programs have briefly mentioned research that new residents can partake in. What kind of research do residents engage in every one of the programs that are here tonight?
So I would like to share our experience at UF. We have the clinical research track where you get up to 6 months in elective to get the opportunity to do research blocks. We usually do the biostatistics course, Introduction and Advance by Stanford, gets purchased by the program for the residents who's on that track. If you are presenting at a national conference or international conference, you get reimbursed for your trip and your fees and tuition for the whole thing. One of the things that in almost every subspecialty, because we have well-established fellowships, we have a research person who is coordinating all the research projects, and you get to choose a mentor that you want to work with, or you can help ask the chiefs or ask the faculty to find a mentor who is interested in the same field that you're looking to participate in. We almost publish papers out of our program in prestigious journals every year. We have very aggressive researchers. Some of the residents, one of my seniors published 8 papers during his residency, and he's in Texas Heart now. I think we have enough support for people who's interested in research too.
Awesome. Thank you, Dr. Jara. We have time for one more question of the night. How does your program support the mental health of residents and other providers? This is open to all programs.
I can say a few words from Emory. So I think we have multiple kind of initiatives to support the mental health of residents. It's something that we take, we definitely place emphasis on. So in the past couple of years, we've instituted wellness days. So initially they were half days, and then based on feedback from the residents, we turned them into wellness whole days. So residents have the opportunity to do whatever they want with this wellness day. So if it's, going to get their nails done, going to an appointment, or just taking the day off to kind of relax. We're pretty flexible on the wellness days, and every resident gets one each quarter. And in addition to that, we have a pretty strong support from Emory GME with our faculty staff assistance program. So all of our interns have the option to meet with one of our counselors kind of on an opt-out basis towards the the middle of the year, just to kind of check in. And we've gotten really positive feedback from our interns, and the faculty staff assistance program provides counseling. They provide up to 8 sessions of counseling for kind of throughout the year, throughout residency. We have really, really great counselors who really know kind of the struggles that residents face. And so it's a program that a lot of our residents use. We also have a peer support program. So, if there's some difficult patient situations, in the PICU or throughout other services, we get notified, and we have a peer supporter reach out to our residents to kind of check in, make sure that they're that they're doing okay, because some of the patient situations that we face on a day-to-day basis can be difficult. And we also have, specifically for our PICU residents, we have a monthly sort of debrief where residents can kind of meet with one of our staff psychologists and sort of have a chance to process, being in the PICU for the first time, seeing difficult patient situations. So it's not just kind of once throughout residency, there's multiple opportunities throughout the program, in addition to, great support from our program admin, and speaking as a chief as well. We really do prioritize our resident wellness, and we're always looking for ways to kind of improve our resident wellness. In addition to one other thing that I forgot to mention, we instituted a meeting in medicine program as well, where residents are paired up with a couple of faculty mentors with residents from all years, and it really fosters an environment of collaboration, and just being able to meet and mingle with residents from all years. It really fosters a lot of camaraderie, and we have really great discussion and just a lot of fun with our meeting and medicine groups.
Yeah, and there's it's a really nice time for community building, and then there's also just some relax and unwind and recharge kind of events, like a Canvas Cafe for art with our resident artist, where there's food and art projects and just all sorts of different things throughout the year for residents to get together and kind of have a sort of semi-structured activity, but also just kind of hang out and decompress and build connection with one another.
Awesome. That's so great to hear. Thank you, everyone, for coming in tonight. Hopefully everyone got to get the chance to learn a lot about more the South Atlantic Part 1 programs and everything they have to offer. As the FPR Associate Webinar Director, I'd like to just reiterate again how grateful we are to all of you guys, the program directors, the coordinators, and all the other representatives who came tonight, and especially our residents who are now going to be the stars of the show for the next 30 minutes. Thank you guys. If you would like to, please kindly log off. If you are a program representative, we are going to transition to our resident happy hour.
Thank you.
Thanks.
Language line service, literally. That's how many languages our residents speak amongst themselves. And we have people from Central America, South America, Africa, Asia, all parts of the Americas, the Caribbean region. So very, very diverse program and we also serve a very diverse patient population. So I think our residents really do reflect the populations that they serve. And I'll stop there.
Thank you so much, Dr. Marissa. Our next program is Advanced Health for Children. Please unmute and the floor is yours.
Thank you. Good evening, everyone. My name is Shani Cunningham. I am the program director at Advent Health for Children in Orlando, Florida. And I'm joined tonight with my associate program director, Dr. Samantha Carroll, who's here with me. And we just wanted to share a little bit about our program and about our residents.
Good evening, everybody. Good evening, everybody. My name is Samantha Carroll, and thank you, Shani, for the welcome. I am the Associate Program Director here at Advent Health for Children's in Orlando. I'm also a pediatric hospitalist as well. I recently took over the role as Associate Program Director, and I've been a part of the institution now for 7 years. We have an amazing hospital, and we have a lot of great resources for residents. As you can see on the slide, we are a fairly large hospital. We have 200 beds, and we have a wide variety of pathology. One of our big strengths is that we now have liver, kidney, and we do bone marrow transplants. So our residents are able to see a wide variety of pathology. We also, in addition, have a level 3 NICU, and we also have an epilepsy monitoring unit. So we see a lot of very good, diverse pathology. We have over 140 subspecialists that work with us. We have peds rheumatology that we recently added, and we have seen so much great pathology. So if you're wanting to see a lot of the zebra cases, we've seen a lot of the zebra cases, but we also see a lot of the bread and butter pediatric cases as well. So I will turn it over to my colleague Shani to give some more information on our residents.
So as far as residents, we are a small program in a medium-sized children's hospital. So we have a program of 18 residents, and we're really looking for people that are driven, that are fun, enthusiastic about learning. Like Dr. Carroll said, we have some wonderful pathology in Orlando. And it makes for a really fun learning environment. We are a hospital that does not have any fellows, so all of the procedures that you'll do are going to be side by side with your attending. And I think it makes for great experience and great learning. We have a wonderful mix of residents who are from the US and some residents that are from international countries as well. We have a wonderful mix of MDs and DOs in our program. And we really think that this is a strength for our program. We absolutely love seeing everyone and getting to know everyone as part of one of our initiatives throughout the year. We're going to talk a little bit, I think, just about our curriculum, and I'll turn it back over to Dr. Carroll for that. And then I will just give you guys a little bit more information about some of the programs that we have at the hospital.
So in regards to our curriculum, we do a block schedule. We also have for our interns, we do a simulation week, which every December, the residents do a week of different labs. They do mock codes. We do a suturing clinic. We do ultrasound training. We do Breaking Bad News. We do a lot of fun things, and actually it's probably one of the highlights of our program, and the residents absolutely love and enjoy the sim week. We also do frequent mock codes throughout the year, so you'll be very well trained in being in those respective codes. And we also do as well a intern boot camp in the month of July. We also have an amazing continuity clinic. It's out in Winter Garden, so it's in a kind of a suburban area, but there's a lot of wonderful, great pathology in that clinic, and we work very closely with them, and a lot of times they help us with a lot of our discharges from the hospital and follow-ups. So I will turn it over again to Shani to talk about some diversity of our program.
Great. So I think one of the questions that always comes up is how do we ensure that we're making sure our residents are prepared through diversity initiatives? We have a longitudinal D&I curriculum that we start off beginning of the year with as just to get to know each other, because our backgrounds are all so different. I will tell you myself, I'm born in New York, raised by Jamaican parents, and we all just give each other 15 minutes of morning report time to just talk about ourselves. After that, we move into topics that have to do with the health and strength of our patients and their families in Orlando. We spend time during simulation week doing sims for cultural humility and making sure that our residents are prepared to treat people and patients from various backgrounds. And we actually end the year with additional lecture time, and that usually happens about once a month, that pertains to D&I topics that are relevant or current events. We also take wellness very seriously. We have a dedicated licensed mental health worker that is solely for GME within our hospital. Everyone meets with this person at the beginning of their training. We really want to make it a part of who we are as a program. And so that time is set aside.
Your time is up.
Thank you.
I apologize for the interruption, but we want to make sure all programs have enough time to talk.
No. Thank you guys so much.
Thank you to you. Next up, we have Orlando Health.
Hi guys, my name is Mariam Zaini. I am an associate program director at Orlando Health Arnold Palmer Hospital. Thank you so much for having me today. I actually did my residency at Orlando Health Arnold Palmer. My chief residency stayed on as faculty as a pediatric hospitalist, and now I'm associate program director. I'm really blessed to be in this role and grateful to be able to continue to work with the residents every day. And I really, truly love and am passionate about our program. Our program is a medium-sized program. We have 16 residents per class. And so everybody gets to know each other. It feels like a family, but it's still large enough that we have a really robust amount of diverse experiences throughout the hospital and subspecialists. We also are a level 1 trauma center, and we have a huge NICU and nursery where we have 40 babies delivered each day at our hospital. So we get a lot of really good newborn exposure and NICU exposure as well. We have 6 fellowship programs, and that's a really great opportunity to be able to work with fellows and kind of learn from them and have them be an additional source of learning and education as well. And so they're a really big asset to our program. We also have a lot of special curricula. So we have a quality improvement curriculum, as well as also a wellness curriculum, and we also do a humanism curriculum that all of our residents participate in. Our big part of our program is an emphasis on resident wellness. We do have physician coaches that meet with all of our residents as a source of kind of inspiration, as well as anybody who's going through any challenges. They already have that established rapport with our coaches and can help with kind of battling burnout and all of those things. Additionally, we try to make the workday really fun. We have special events all the time. Every Saturday is Superhero Saturday. So everybody in the hospital dresses up, the nurses, the faculty, the residents, and it's really a lot of fun. And it just is a really great experience for our patients as well. We also have a heavy emphasis on both diversity and health equity. We have a Train the Health Equity curriculum where we do monthly case conferences where we're discussing different health equity topics, social determinants of health, racism in medicine, women in medicine, among other topics. Additionally, kind of just talking a little bit more about our diversity initiatives, all of our residents actually do health equity training in the beginning of their residency, and that kind of serves as a board by which we all kind of be able to communicate about health equity. We have a really great diversity council where we have a lot of events both within GME ourselves and other programs within the institution, and then also just pediatrics. We do a lot of different social events, a lot of educational events. Cultural Food Day is one of our top events that we have each year. We do cultural jeopardy, and then we do, of course, a lot of training, like implicit bias training, to make sure that our residents and faculty are equipped to take the best care of our diverse patient population. We have a very diverse patient population. We are fortunate to take care of travelers, immigrants, patients from all different walks of life and all different socioeconomic status, and we get to help navigate that, and we're very fortunate to be able to take care of patients from all different backgrounds. We also have a simulation curriculum from mock codes. We also do Breaking Bad News workshops as well. So those are all really great opportunities to kind of practice those practical skills. The other kind of highlights about our program, we do offer scholarships for underrepresented in medicine minorities, and we have, like I said, a really big emphasis on diversity within ourselves as a residency program and within the institution as a whole. We have some other special kind of unique curriculum. We have block scheduling, and we have a few rotations that are a little bit more unique to our program. We have a medical education rotation where residents learn about how to educate others, whether it's patients, families, and other learners. We also have a parenting elective as well as a mental health elective, and we are also now fortunate to have psychiatrists on staff as well, which is a really great addition to our hospital and has really been a great resource for our patients as well. We also, overall, obviously, Orlando is a great place to be in. It's sunny, beautiful weather, and you know, not only is obviously there's Disney and the theme parks, but there's also it's great proximity to beaches. The airport is close by, so you're always a flight away from any destination of your choice. And then there's also some other areas of Florida to explore, whether it's the natural springs, the hiking trails. There's really something for everyone. There's beautiful, you know, performing arts center. There's so much to do in Orlando. Anytime I check one thing off, I add another 3 things to my list of things to do. So it's a great place to train and a great place to live, and truly is an awesome place to not only feel like you've had a good training and are going to be prepared to be an awesome pediatrician, but also have fun while doing it and have a really great work-life balance. And with that, I'll end. Thank you guys. Let me know if you have any questions.
Thank you so much. Our next program is Johns Hopkins of All Children's Hospital.
Hello, everyone. I'm Dr. Robleski. I'm the Pediatric Residency Program Director at Johns Hopkins All Children's. I'm joined tonight by our Program Administrator, John Jones, who is also on. I actually am a newcomer to Johns Hopkins All Children's. I joined as Program Director July 1st. So coming into a new program, it's very exciting, all the things that are happening here, and I'd love to be able to share that with you guys. So Johns Hopkins All Children's is located at All Children's Hospital on the west coast of Florida, Gulf Coast. It's a 259-bed specialty pediatric hospital that opened in 1926. And in 2012, the residency program opened with an affiliation with Johns Hopkins in Baltimore. Since that time, it's been growing. Our residency program is 12 residents per year, but also growing fellowships around the subspecialties that we have in the hospital as well. So we currently have fellowships in neonatology, hospice palliative care, peds hospital medicine, peds neuro-oncology, critical care medicine. First fellow in pediatric cardiology started this year as well, with the goal of opening 1 to 2 fellowships every year for the next few years. So a lot of change and growth is happening here, which is not only benefiting our patients, but our residents as well. We have a coaching program where incoming residents are all paired with a faculty coach as well. And the program really is developed around the goal of personal and professional development for our residents, which is in part basically showcased by different programs that we have throughout the years for the different levels, including a leadership development curriculum, which is a 2-week curriculum for the first years and a 1-week refresh for each of the years after that. There is an end of year step up curriculum for our residents going between 1 and 2, and then a patient experience week also, which incorporates our diverse patient population in, as well as other multidisciplinary ways to look at patient care. We also have tracks in research, quality improvement, and advocacy that our residents can get certificates in throughout residency as well. Our curriculum is a 6-week block schedule, which is a little different than the typical 1-month or 4-week block schedule. And many of our inpatient rotations do have dedicated didactics, although we do have a regular weekly didactic schedule as well. We do have 6 weeks in our PGY2 and 3 years where residents can have more individualized curriculum for their own professional development. Also, there is dedicated scholarship time for our residents to work on scholarly productivity with the goal of presenting and publishing. And also, because we do have the affiliation with Johns Hopkins, our second-year residents have the opportunity to do rotations away in Baltimore. Through Hopkins, we also have the benefit of having all of the resources that would be available to Johns Hopkins down here in Florida. As far as like diversity initiatives, as everybody's been saying, we do also have a very diverse patient population, not only with different medical diversity, but as well as cultural diversity as well. We have actually an international program that brings patients from all over the world to All Children's Hospital for care, and projects within the community to help, obviously, with early intervention. And at this point, because I have been here less time, I'm going to turn it over to Dawn to talk a little bit about the area and what St. Petersburg has to offer.
Hello, everyone. Good evening. I'm Dawn Jones. I'm the program coordinator, and I've been with the program for 11 years. I was born and raised in St. Petersburg, so I'd love to tell you a little bit about our special community. So if you're familiar with the state of Florida, we're on the West Coast. We're that area that looks like a uvula. Oh, pardon? Can you hear me?
Oh, yes. So sorry.
Okay.
I was just
okay.
letting people know that it's 1 minute remaining.
Oh, okay. Real quick. So we always have a lovely sea breeze. We have professional sports teams here in football, baseball, hockey, and soccer. We have a lovely sea breeze, and we have surrounded by water. So there's always opportunities to be on the water. Plus, we have a fantastic art scene, foodie scene, brewery scene, wine scene. And it's a great place to go bicycling. I want to highlight, if you are a medical student that is really curious and is a self-directed learner, that our program will help you set up to be successful.
Thank you so much for that wonderful presentation. Next up is University of Florida, Pensacola.
Hi, I'm Dr. Diane Wilkinson with the University of Florida in Pensacola, which I guess there's our slide. I've been the program director here for 2 years, but I've been with the program since I came here as an intern in 1988. So I've been here quite a while. I came from Mississippi originally, but really fell in love with Pensacola as a place to live, and especially with the hospital as a place to work. I'm joined tonight by one of our assistant program directors, Dr. Carrie Garrison, and I'm going to turn it over to her and let her tell you a little more about our program.
Hey guys, my name's Carrie Garrison. I'm one of the APDs here in Pensacola. We are a smaller children's hospital and a smaller residency program with 9 residents per year. But I feel like we're unique in that we're small but mighty. That's what I tell people. We have a robust experience with a children's hospital within a larger hospital system. So we get to see and experience all the pediatric support from therapy dog programs and all of the pediatric ancillary services that you would expect to see in a children's hospital. But then we are side by side with an adult hospital, which brings along with it several other GME programs. And so we have visiting residents from family medicine come join us, as well as we have other GME training programs on site. So that gives a little camaraderie, and folks kind of feel like they're not just the only residency program around. So Studer Family Children's Hospital has over 20 subspecialty services here. Like I mentioned, we are a community-based hospital with an academic affiliation with the University of Florida. We have our own pediatric ER, our own pediatric OR. I'm a pediatric intensivist myself, and we have a level 3 NICU. We have a regional trauma center, so we see a fair amount of trauma. We are located in the northwest corner of the panhandle of Florida, so we are the westernmost city, pretty much, of the panhandle. So just to give you some geographical reference. We pride ourselves in being open to feedback and incorporating that feedback into our program, and recently revamped our schedule. It is a block schedule, but we recently transitioned to a few less inpatient rotations, which I think made a few of our residents happier. We do also have strong clinical experiences in primary care, and about half of our residents choose to do fellowship versus primary care. We have an underserved population here in Escambia County, which is where we're located. So we get to experience and help support that population, which is really rewarding to our residents. There are call-free electives in all 3 years, and we have a lot of traditions. We pride ourselves in being quite social and having holiday parties, but also celebrating diversity during our wellness week. And we really hope that that comes through for our trainees. I should also mention that our therapy dog program is something that's really a big favorite amongst our residents. We have 4 dedicated therapy dogs that go throughout the hospital. They actually sort of live in the hospital, and they have their own little spaces. They don't live in the hospital, but they have dedicated spaces where they stay. For example, we have one that hangs out in the radiology suite. So anyone who comes, any pediatric patient that comes to pediatric radiology can expect to see Tully, our radiology therapy dog. And so some of the other therapy dogs come up on the floor in the HEMONC unit, and the residents really enjoy that just as much as the patients, I feel like. So we would describe our program as diverse, family-oriented, and supportive. And we hope that that comes through both here tonight, and if you were to come interview with us. We do accept J1 visas, and like I mentioned, located in Northwest Florida. The thing I'd like to also mention about our area is that we are a fairly low cost of living, and we are located along some of the most beautiful beaches that you've probably all heard about on the Emerald Coast. So we're very close to Destin, 30A, Panama City, that area. So a lot of residents choose outdoor beach-related activities to blow off steam and have some fun. Let's see if I can tell you anything else. We also have a parenting elective, which is kind of new. I wrote that down to mention. When I came here, I became a parent in the last few years, and so I've been with the training program about as long as I've been a mom, and so I found it really a passion to share that with the trainees that I'm working with. So I'm currently the mentor of a parenting elective. We have no fellows here, so we do offer some away rotation opportunities, specifically with UF Gainesville being a sort of a part or a cousin program to us. So we do send some residents over to Gainesville to get a more of a fellowship experience, fellowship type program experience. And I think that's about it. Anything else, Diane?
Sorry, your time is up for today's presentation. I'm so sorry. And I also want to apologize for mispronouncing the program initially. So sorry for that. Our next program is Nemours Children's Hospital.
Hey everybody, I'm David Hash, he, him. I'm stepping in for Dr. Bria tonight, who is on vacation, and her daughter's birthday is tomorrow, so we gave her the night off. Nemours is a little bit unique. There are multiple programs in Orlando, but we are a freestanding children's hospital with approximately 135 beds. We're currently expanding our inpatient, ED, and HEMONC services. I think one of the most unique things and fun things about our programs is we've developed a big little grant system. So when we match new residents, the upper level residents kind of adopt one of the new interns into their class, and we group them together on the same continuity clinic day. So it kind of builds in some senior mentorship for the incoming residents and people that you get to work with for 3 years. Our continuity clinic is in downtown Orlando, so it's separate from the hospital, about a 20 to 25 minute drive. It serves a very diverse patient population. One of the other things about Nemours is we do have some special curricular events, including the Nemours Academy of Master Educator, a class that I've gone through, which is a medical education course. We have a Quality Champions course. We have a very robust simulation department that travels to do off-site simulations, and approximately once a month we have 2 hours of simulation on Fridays. Our program sends about half, maybe 60% of our graduates into fellowship, with the other half going into general academic pediatrics. We also started this year 3 new fellowships in pediatric emergency medicine, pediatric endocrinology, pediatric hospital medicine, and we're expecting to have 4 more fellowships within the next 2 years. We also do block scheduling. One of the things that's a little bit different with us is we still do the traditional 24, 28-hour call. I know that we get a lot of questions about that. We feel like overall it's a little bit better because that means that, say, in your intern year, you'll have 4 months of call, but for the other 9 blocks, you're basically off weekends and evenings. So it just concentrates your call a little bit more. I'm not going to lie, they're harder months, but the upside is you get a lot more weekends off. We are a medium-sized program, currently at 12 residents per class, so a total of 36. We do have MD/DO and a few international medical grads within our program. We have a lot of diversity within our class. I think at last count, we had 15 different languages that were spoken within our residency class. We also have our DRIVE initiative, which is diversity, anti-racism, inclusion, value, and health equity. That's very active. There is a resident branch of that committee that meets with the overall leadership. One of the other things about Nemours is we're a very strange institution in that we have, as part of our enterprise, a larger hospital that's in Delaware. We're the only children's hospital enterprise that actually has children's hospitals in 2 different states. So we have a huge catchment area in Florida, and then we also have this huge catchment area in Delaware. So for research purposes, it's pretty easy to gain access to all that information and do research. We also do have a research requirement for our pediatric residency program, which is supported by a research curriculum. So we start off with our interns in the first couple months with walking through how to build a research question, pairing them up with mentors, and then regularly scheduled meetings about where they should be in the research project that culminates in a presentation as part of our research week at the end of the 3rd year that we do every year. I can't say enough about Orlando. Everybody kind of knows what's available, beaches, everything else, great food. And I'm going to cut it short and let you guys have the benefit of 1 minute back. Thank you.
Thank you so much. That concludes the pediatric program overview portion of the evening. Thank you so much to everyone for such wonderful presentations. And I apologize again for the interruption at the end. Now we're going to open up the floor for a live Q&A. Please feel free, whoever's in the room, to unmute yourself and ask your questions. Or if you feel more comfortable, you can put them in the chat box. Yes, Annalise, please feel free to ask your question.
Hi, my name is Annalise Brown. I'm an IMG from Jamaica. Great presentations, and it was great learning about your programs. My question is, how important is it for your program for an IMG to have step 3?
I guess I can start by saying that for us, you don't have to have step 3 when you enter the program. You do need to have the institution requires you take it and pass it, hopefully the first time, but you have until the end of 2nd year. You do have to have step 3 before you enter the 3rd year of training, but it's certainly not required to match into the program.
And I'll echo that. I'm sorry, go ahead.
Oh, sorry, I was going to say likewise. Yeah, it's not required for our program.
Right. Same in Pensacola. We don't require you have step 3, but we do, obviously require that you pass it before you can graduate.
And Annalise, the same for Advent. We typically recommend the interns take it during their 1st year, but it is required before moving on to 3rd year.
Same for Nemours.
Same at Johns Hopkins All Children's.
Okay, thank you so much.
Someone asked, is USCE necessary for application? I'm not sure what USCE stands for, sorry.
Oh, it stands for United States Clinical Experiences. I believe that's more tailored for international medical graduates.
Not necessary in our program, as long as you have some experiences, at least in your home country.
The same here in Pensacola. We don't require it, but I will say that it does look important on an application.
Same for us. I think it enhances your application, but it is not a requirement.
I saw a question about USMLE in addition to COMLEX. Dave Hash from Nemours. At least for us, we do not require USMLE in addition to COMLEX. I do think it's advantageous somewhat for DO students to do that because I think a lot of people in the GME world are just more familiar with USMLE, so it's a little easier to have them compare apples to apples, but it's certainly not a requirement for us.
Same
at Orlando Health.
Yeah, we don't require, and we've always had a fair number of DO residents, so we don't require USMLE for them.
Same at UF Pensacola, we don't require it.
Same at Johns Hopkins All Children's.
Likewise for us.
Nice to see we're all on the same page.
One of the questions that we had previous to the webinars starting is, how do you prepare your residents for the next step in their medical journey, either if this is fellowship versus attending and becoming better teachers and mentors?
That question has many facets to it, and I'm sure for each one of us, we could take at least good minimum 5 minutes at the very least to answer that. So many different ways: mentoring programs, individual one-on-one mentorship, individualized curricula, all that type of thing. And I can see the other PDs and APDs nodding. So I would say it seems like a lot of us have many of the same initiatives.
Thank you. And also, I forgot to mention initially, but for the Q&A, we do have a total of 15 to 20 minutes to answer questions. So if I know initially I cut everyone for 5 minutes, but I'm sorry, I forgot to mention that for the Q&A, we have a little bit of more time to answer questions. We are, as of now, at 4 minutes and 30 seconds. So we still have some time. There is also another, oh, sorry, if somebody wants to answer the previous question.
I was just going to add, for a smaller program like ours in Pensacola, I feel like that does lend itself to relationship building, which is a really important part of mentorship and, learning about the facets of your career as you finish residency. So I think it's one of the things that I really cherish about a smaller program. I trained in a much bigger program, and so I've been able to see the differences, and I really enjoy those relationships that I'm able to build early on, even with interns, that maybe in a larger program I wouldn't be as able to do as quickly. So I'm hoping that these relationships are helpful to the trainees that I'm part of their pathway.
Yeah, I would say at Orlando Health Arm we have a really good mentorship program as well. And I think just by nature of residency, you really learn how to be kind of a teacher and an educator as you go into a senior role and have to kind of teach new interns their, all the details of residency, basically. So just even by nature of residency, but we also have again, a formal medical education rotation that really focuses on that. I wanted to also just kind of answer, there's a couple of questions in the chat about kind of what are we looking for in applications? And I think to answer both of those questions, really, it's now there's a big emphasis, at least at our program, on holistic review. So taking the whole application into consideration, what are extracurriculars, what type of experience have we had, whether it be leadership or, within research or quality improvement, what type of community engagement, those sorts of things. I think are going to be, we've heavily emphasized in the past and will continue to do so. And I think that's kind of the best way we're going to have going forward to be able to really filter applicants, since they're now with the step one being pass fail, but also just in general, because that's really what we've found to be better ways to pick residents, because that's really what matters and what's important more than a number or score.
Yeah, Dave Hash at Nemours. I would like to echo that. I think that was very well said. I don't know that there's a single criteria other than going to medical school that really is a must-have to get in. And I think we've seen a significant swing more towards the interview day, the extracurricular activities, research activities, and kind of the rest of the file, because we all expect a lot of this objective data to go away. We've seen a lot of medical schools move away from actually scoring, class ranking, and everything like that. So it's been a national debate about, how do you then select applicants? And the answer is a good holistic review where you look at the applicant as a whole and pick the best people and invite them. And then it's all about fit. I will be the first one to tell you, you may have the most beautiful file in the world, but if you're not going to fit in at our program, I'm not going to recruit you. And I think that's all what both sides are looking for, is that fitness.
So I'm going to address the next question. It asks about electives and traveling. So in our institution, you don't have to travel. We actually have, Nemours has a specialty clinic here, but it's only outpatient. There's no inpatient. The inpatient hospital is the one in Orlando that all of you heard about, but we are connected by a sky bridge that runs over I-95. So nobody has to go anywhere for electives, but you do have to travel for your outpatient clinic. Essentially in Jacksonville, to move around, it's a very big city. It is actually the largest city by land area in the continental US. So you will need a car here. There is very poor public transportation except outside the city core.
Here in Pensacola, we actually, because we are a smaller community, our residents can do all their experiences right there on our same campus. Our outpatient general peds clinic is on campus. The subspecialty clinic is there on campus, right there by the Children's Hospital. So we do have, and we also have, as far as a community, we have a lot of opportunity for living near the hospital. Several of our new interns this year still, have yet to be able to purchase vehicles and are riding their bikes and getting themselves to the hospital in other ways.
Yeah, the odd for Nemours, we similar thing as in Jacksonville for the continuity clinic. It is like a 20 or 25-minute drive, and then of course, we're a freestanding children's hospital, which means we don't deliver babies on purpose. So for the newborn nursery rotation, we do travel to a different hospital for 1 to 2 months to do that.
At Orlando Health Arnold Palmer, we have everything on one campus. So our newborn hospital, as well as the children's hospital and continuity clinic, everything is on campus.
And the same thing in St. Petersburg at Johns Hopkins All Children's. We're basically in a 4-block radius in the downtown area. There's a lot of living in the downtown. In fact, I live 5 blocks from the hospital, so I could walk every day to work if I wanted to, and a lot of the residents do as well. It is actually a city which has decent public transportation as well, and can easily get around on scooters and bikes and live downtown. So if somebody is looking for a place where they don't have to have a car necessarily, this might be a place. Some of our community stuff that we do is out in the community, but otherwise, continuity clinic, newborn nursery, everything is right located on campus.
I'm sorry, I just wanted to clarify, we do have two hospitals, the Children's Hospital as well as the Safety Net University Hospital. And so you, besides our clinics, you do have to travel, but when you have your rotation, you are at one site. You don't travel on a daily basis. It's just when you go to different sites, you would need to, and you would need a car here for sure.
For Advent, we do require you to travel for continuity clinic. That's about 20-25 minutes from the main hospital. Everything else is accessible from the main hospital.
I do have to tell you guys just a fun fact. So I think we are one of the, amongst the programs represented in this session, we are probably one of the oldest training programs. And actually, I see two of the program alumni on the screen. Yes. There you go.
I was going to mention that. It's funny, but you know, I'm sitting here and I'm listening to Dr. Mirza. That's where I did my training. And I've actually spent time working as a hospital assistant in the ED at All Children's before it was John Hopkins, because I'm really old. And I think one of the things you guys will find out is it's a relatively tight-knit community, and we've all worked with each other or trained people that each other are working with. It's kind of fun to sit here and see all the faces and hear all this.
1 minute left for our live Q&A session. If someone in the chat wants to, if someone in the room wants to ask the last question of the night before we go into our resident happy hour. Sorry, I'm not sure if someone is trying to say something. I hear some rumbling, I'm not sure.
Sounds like the old-fashioned dial-up modem sound.
Yes. Okay, well, if we don't have more questions for today, I want to thank you. Hopefully all of you got the chance to learn a bit more about all that our South Atlantic Part 1 programs have to offer. We want to reiterate how grateful we are to all the program directors, coordinators, and other representatives who took the time to join us tonight. We will now ask program directors to kindly log off